So, shall we start with something? Give me that events list. And guys, one of our personnel will be taking the details of all the doctors whose certifications has to be ready for having registered in the Indian chapter of the International Association of Cell Therapy. So please ensure that if I will have one of them come to your tables and ensure that they will take it out. And please ensure that you take your photos in front of the photo booth so that your faces or your identities are revealed on the website. Yeah, so basically that's all about it. That's today's event. Let's start rolling.
Thank you, Dr. Ravitejalam, for setting up the agenda for the day. And now let's delve into a keynote address by Dr. Simon Yefimov, who's going to share insights about metabolic syndrome with a bioregenerative approach.
Hello, good morning, everyone. Happy to greet you again. Thank you. Let me have the pointer and we can start the lecture. So today's my presentation is about, it covers, of course, the metabolic syndrome, but the most valuable part is that I will explain you what are the stem cells. Because obviously, thank you. Obviously, I bet all of you can explain somehow what is a stem cell, but not many people realize actually what it is, and how it works, and how would you define a stem cell? Like, what's the difference between usual mature cell and a stem cell? Does anybody know? Okay, so I will explain. Let's start from the cell, okay? We have a mature cell. So this cell is like a minimal unit of a functioning tissue. And it's like a minimal viable organism. And then, as we have discussed yesterday, from the cells we get formed tissues, tissues form organs, organs form systems. And we have different organ systems due to that. All of them, they perform different functions. Of course, all of them are interrelated, but then still we differentiate those. So how does it come that from just one fertilized egg, from a zygote, which is one type of cell, right? How does it come that we have these many types of different cells that are responsible for forming of different systems? What's the process of one cell being transformed or developed into many, many different types of different cells? So obviously there is a process called differentiation. And in other words, you can refer to this as maturation, or if you put an analogy with like human world, for example, differentiation is a kind of getting a profession. So we have, in the beginning, we have undifferentiated cells, meaning totipotent, or also called as embryonic stem cells. So these are like kids in the kindergarten. And you don't know if this kid's gonna be like a lawyer or a doctor or a constructor or whoever. Because there are many, many steps. This kid goes from kindergarten to school, then he graduates the school, then he goes to college or university. So all of these steps, they define more and more specifically what kind of profession this kid would have. Same goes with the cells and differentiation. From being totipotent embryonic cell, and totipotent means that there are many ways these cells can differentiate into. They become more differentiated, so first they go into three types of cells, which are endoderm, mesoderm, and ectoderm, and they become pluripotent cells, which means that from this stage, there are much less ways or much less options for the cell to differentiate into different types of tissues. So after that, having even less amount of ways, we get multipotent cells after next stage of differentiation. And then at the last stage of differentiation, we get different types of organs, different types of cells, which would be like cells of our organs, or cells of internal organs, or musculoskeletal system, or cells of the blood, so on and so forth. And this is a representation of those different stages of differentiation. So zygote has totipotent cells, then embryo has pluripotent cells, then we have tissue stem cells that are multipotent. They can become, like for example, on the next slide I will show you cells in the way of differentiation, or so to say hematopoietic cells. So these are cells that would become some types of cells of the blood. So they are already like tissue stem cells, but still have few levels of, or few ways of possible differentiation. Like here we can see. We have multipotential hematopoietic stem cell. Then it goes differentiation either to common myeloid progenitor, either common lymphoid progenitor. Next stage of differentiation, they would become either megakaryocytes, either erythrocytes, either mast cells, either myeloblasts. Myeloblasts, in their turn, they also can go through different stages of differentiation, like one of the way, like going into macrophage. So, interestingly enough, all of the cells here, all of them are stem cells. All of them are stem cells. Technically, physically, literally, these are all different types of stem cells. So the difference of stem cells is not only they can be stem cell of this tissue or stem cell of that tissue like precursor, but they can also be different stage of differentiation stem cells. So embryonic cells are stem cells. Tissue stem cells are also stem cells. Progenitor cells are also stem cells. All of these are stem cells. So it's quite important to understand what stem cells we are talking about when we are dealing like with the treatment protocols. And actually this way of differentiation, this path of differentiation is known as Weddington landscape. And in the beginning we have obviously undifferentiated cell, then going through different stages and different ways of differentiation. By the end of the day, we get stable minima, so-called, which is differentiated matured cell of some organ or some tissue that performs the function. So these are not stem cells. These are matured cells. Everything that goes before that, all of those type of cells are stem cells. And actually, there is a very, very simple definition of a stem cell. So stem cell has two characteristics. First of all, it has ability to differentiate, to get mature, so it has certain steps of differentiation forward. And second of all, one of the most important parts, or most important characteristic of a stem cell, it can multiply itself. It can divide into more cells of itself. Because mature cells, they cannot multiply. The amount of cells of mature tissue you have, you would have that same amount whatsoever. But if you have, let's say, a pool of stem cells, you put them in certain conditions with a cultured media and so on, and so you can see that they multiply themselves. And you will see that the colony grows. So stem cell, they're able to grow. And obviously, like, why would we need stem cells after we get born? It's obvious that during the development of the fetus, we need stem cells to form the tissue. But then when we are born, of course, we need stem cells or new cells to get developed, to grow. After the age of 25, when we stop developing or growing, why would we need stem cells? We need stem cells because all of our tissues, they go through remodeling process during our life. Even our bones, on a span of 20-25 years, all of cells of our bones, they get turned over. So with me being 34 years of age, I don't have any cells in my bones that I had like when I was 10 years old. All of those cells are new, and all of them come from new stem cells. And of course, everybody knows about mesenchymal stem cells. We have discussed there are many types of different stem cells, but at the market, obviously, the most popular one everyone knows about is mesenchymal stem cells. And here we can see different sources where you can procure this mesenchymal stem cells particularly, which are umbilical cord, Wharton's jelly, cord blood, bone marrow, adipose tissue. And mesenchymal stem cells, yes, they have the characteristics of stem cells, obviously, because they can differentiate into few types of matured cells, and they can multiply themselves. And mesenchymal stem cells, they can differentiate mostly into 5 types of tissues. Here you can see more, but mainly this is adipose tissue, which is fat, and this is connective tissue, this is cartilage, this is bone, and these are muscles. So these 5 types of cells, they get the origin from the mesenchymal stem cells. So obviously, for such diseases as bone diseases and cartilage diseases, or musculoskeletal system conditions, obviously mesenchymal stem cells would be #1 choice. But it's important to have a note that different sources of mesenchymal stem cells, interestingly, they produce a bit different effect. So some of the mesenchymal stem cells, like from the blood cord, they're more effective in terms of immune system. Some other sources are more effective for musculoskeletal system rejuvenation. So there are also some specification about the source of the mesenchymal stem cells, the route of administration of mesenchymal stem cells, and obviously the amount of those stem cells. All of these characteristics are important in order to achieve the desired effect. Like what kind of other effects mesenchymal stem cells can produce is paracrine effect. So paracrine effect is signaling or communicating in between the cells by means of signaling peptides. So we have, for example, hormonal system, and it's communication of the cells on a big distance, so to say, from each other. It's called endocrine communication. Paracrine communication is the same type of communication between cells that are close to each other. So by producing paracrine effect, these mesenchymal stem cells, they produce those signaling peptides, and these signaling peptides, they would bind to a receptor of our recipient cell. They would produce anti-inflammatory effect, they can produce immunomodulation, and they can stimulate cell proliferation. So these are the effects you can wait for mesenchymal stem cells to produce on all other tissues, aside from those 5 types of tissues they can differentiate to. Namely, that if you wanna have some solutions for musculoskeletal system and you do mesenchymal stem cells, yes, you can have good results. But if you are trying to treat any kind of other tissue, let's say liver, for example, then the maximum effect you can obtain from the mesenchymal stem cells is only paracrine effect. So doing mesenchymal stem cells for fatty liver, for example, or for liver cirrhosis, the maximum effect you would have just from signaling peptides from mesenchymal stem cells, but nothing much more. And as we've discussed yesterday, if we need to regenerate the liver, it means that we want to bring the functionality of the liver back, or functionality of its tissue. And if we take a close look, like normally, all of this, let's say, are healthy hepatocytes, and some of the cells are going through apoptosis for the remodeling process. So this is normal. Like some cells are dying to be renewed for the new cells because all of the tissues go through the remodeling. But then let's say if there is a fatty liver disease or liver failure, we have different stages as we discussed yesterday. So beginning of the liver damage, stage 1, stage 2, stage 3, stage 4, meaning that each of these stages is characterized with less amount of functional hepatocytes and bigger amount of cells that are not hepatocytes. Like for fatty liver, this would be adipocytes, meaning that cells of the fat, they get, old hepatocytes get exchanged for cells of the fat instead of new hepatocytes. So the tissue of the liver becomes, instead of being a tissue of a liver, it becomes a fat tissue. And obviously, fat tissue cannot perform functions of the liver. And if we take a closer look, the picture would look like this. So very less amount of functional hepatocytes, but much more not functioning cells, not properly functioning cells. So how would you restore the pool? Obviously, mesenchymal stem cells, they cannot differentiate into hepatocyte. Maximum effect mesenchymal stem cells can produce is paracrine effect for those hepatocytes that are still alive. But you need new cells to come. You need the pool of new cells for hepatocytes. So, what kind of stem cells could restore the pool of hepatocytes? And obviously, the most logical step would be is to take these cells that are still stem cells because they can still multiply and they can still differentiate, and they have only one step till the end stage differentiation, till being mature cell. So what we are doing, we're actually taking this last stage undifferentiated stem cells that are called progenitor cells. And this is actually the product of FCTI. These are progenitor stem cells, or so to say, organ-specific stem cells. Why organ-specific? Because we know that there are no other possible ways for this cell to differentiate except of that one last step this cell is meant to be matured into. And obviously, since we have different types of tissues and organs, we are taking precursors of that particular tissue that we want to address. And with the case of liver disease, we would take precursors to hepatocytes. So these are still stem cells, but the only way they can get mature is to differentiate into hepatocyte. Now coming to metabolic syndrome. So what tissues would we want to improve for work in order to fight, to combat the metabolic syndrome? Of course, this would be the organs of our metabolism or our digestive system. And our protocol for metabolic syndrome would consist of stem cells, of precursor stem cells of the liver, precursor stem cells of pancreas, obviously, to produce insulin. Placenta, as we've discussed yesterday, is just to increase the potential of all these cells because it has very high generative capacity and inflammatory capacity. Obviously, we would address stomach. Intestinal mucosa is the lining of the gut that forms the environment for our microbiome, that's responsible for our immune system. And actually, there are many, many different functions that like this intestinal mucosa in combination with microbiome perform in human's body. And obviously, the tissues that get deteriorated mostly due to high levels of sugar, kidneys and eyes, due to they have the smallest vessels in their tissues, so high levels of sugar, they just deteriorate the small vessels, hence there is no proper blood flow, hence why nephropathy and vision impairment are the complications of the diabetes. So with our protocol, we are not only improving, we are not only addressing the cause of the problem, but we are also trying to prevent complications of the disease. And after the cell therapy, actually it goes for most of our cases, we do the cell therapy first, and then we're adding on a course of peptide therapy. Peptides, as I've explained yesterday, are the extracts from the cells. And these peptides, they are also organ-specific. So if we want to regenerate, again, the liver tissue, we're taking extracts from the liver cells, from hepatocytes. So after the course or after the session of stem cells, we would also prescribe at least 2 months of 2 intramuscular injections per week of peptides. And for metabolic syndrome, we have already pre-mixed combination that contains all of those organs in order to improve their work. But then again, the cause of the problem of the diabetes, obviously high levels of sugar, and even if we regenerate the organs and tissues, and we don't take care of the cause of the problem, which is high sugar level, then these regenerated tissues would slowly deteriorate back. Or not slowly. So we need to address the cause of the problem. We need to decrease the sugar levels. Obviously, you may go for conventional therapy using such products as metformin, but at the same time, there are much more lucrative, so to say, alternatives, like this one, for example. So this is plant-derived product, and it's called Swiss Naturo Glucose Management. And it has ability to decrease the sugar levels. It regulates the blood sugar and obviously gluconized hemoglobin. It reduces low-density cholesterol and triglycerides, regulates metabolism, and has anti-inflammatory capacity by having those extracts from the green tea, from Berberin vulgaris, that has very, very good capacity or ability to decrease the sugar levels. And so the use, the protocol is very simple. It's just 15 drops. You can take straight into your mouth, or you can dilute it in lukewarm water and take it. And of course, you have to be careful, because if the person takes any kind of sugar-lowering drugs, all of them gonna potentiate each other. So you have to monitor the sugar levels. Now, complications. So we have just mentioned that the smallest vessels in the kidneys get deteriorated, so the kidneys don't get sufficient blood flow, so there are some nephropathies. There could be problems with the vision, but one of the most famous, so to say, problem with diabetic patients, especially with a long history of diabetes, is of course the foot ulcer. And the mechanism is the same. So at the tip of the extremities, the blood vessels get deteriorated. So there is no sufficient blood flow to regenerate this tissue, to bring nutrients, to bring cells for healing this wound. So there is a problem with a bad blood flow, and it results with this foot syndrome, diabetic foot syndrome. So what are the options, or what are the protocols that we would use in order to improve this condition? We are using a product called Plaque X. It's our proprietary product. We have many different cases with it. So obviously we may use Plaque X infusions. I will explain you in the next slide what it is. And on top of that, you can use, of course, IV lasers, ozone therapy, different physiotherapies from the range of holistic or bioregenerative medicine. So what is Plaque X? As I have mentioned, this is our proprietary product. We have intravenous, so to say, form that you can use intravenously, but we also have soft gels. And the main product and the main ingredient in this Plaque X is phosphatidylcholine. Why is it important, and what abilities it has? What effect does it produce? Well, initially, This Plaque-X product was designed or positioned as a remedy for improving atherosclerosis. And atherosclerosis is the process during which some plaques get formed on the vessels, on the wall of the vessel. And within time, this plaque may decrease the lumen of the vessel, so the blood flow goes down. So what Plaque-X does actually, it can decrease that level of lumen obstruction. It can improve the blood flow. And for elderly people that would have no energy, for example, there were cases people using the wheelchair, but after a few sessions of Plaque-X intravenous infusions, they had their vitality back and they could walk again just without even the wheelchair. So by improving this blood flow, even in the smallest vessels, of course we're improving the work of all organs, and which is why this Plaque-X has very, very beneficial effects for heart conditions, for brain conditions, for liver conditions, kidney and lower extremities, local ischemia, which is actually the problem with diabetic foot syndrome. Ischemia means like not sufficient blood flow. So this Plaque-X has very, very good, as I've mentioned, effects for cardiovascular health because of obviously improving the lipid profile, decreasing the homocysteine levels, and hence decreasing the risk of strokes, heart attacks, and heart failure. And this is the list of all the rest benefits that you would get by using this Plaque-X product. The protocol for intravenous infusion would be the following. So these bottles, they usually come in a form of 50 milliliters, in volume of 50 milliliters, and one intravenous infusion takes only 25 mils of this product, which has to be diluted into 150 or 500 milliliters of dextrose or glucose. It's important because normal saline wouldn't be sufficient for dilution of this product. And then the duration of the infusion should be at least 90 minutes, because fast infusion may result with some side effects like diarrhea, drop in the blood pressure when given too fast, and some very rare cases of hypersensitivity. At the same time, we have this phosphatidylcholine-based product in oral form, which are soft gels. So the protocol would be 1 to 2 soft gels per day, preferably before the meal, if we are talking about Plaque-X. But then also we have a serious range of Plaque-X Extra. So Plaque-X Extra would need only 1 soft gel per day. Next thing I would like to mention is choline complex. So this choline complex, together with the phosphatidylcholine, forms the most precious or most valuable effect or ingredient in these soft gels. And this is a small comparison of different range of this Plaque-X, but mainly the difference is in that concentration of choline complex. Like if you would ask, should I prescribe Alpha Plaques Pro or Alpha Plaques? They have pretty much close effects, but then a bit different concentration of that, particularly of that alpha tocopherol and that choline complex. So yeah, that's about it. For metabolic syndrome, quite easy. We are restoring the function of digestive system with the help of cells. We are preventing complications with the help of cells. We are even enhancing the work of cells with the course of peptides. We are using sugar-lowering drugs to fight the cause of the problems of that complications. And last but not least, we're improving the blood flow through the smallest vessels. We are decreasing the ischemic events. Hence, we get a healthy patient. Thank you for your attention. Anyone's got a question for me? Yes, please. Yes. Well, I have to tell you that different organs, they have different specificity or ability to regenerate. So some organs and tissues are quite easy to regenerate, like let's say liver. Liver is the easiest organ to rejuvenate, regenerate, and so on. But for some organs, it's much more difficult, like kidneys, for example. And for chronic kidney disease, we have very good results at the stage 2B, 3A, 3B. But after the stage 4, for example, it's very, very difficult to regenerate. And like those cases are more anecdotal. So yeah, it depends on the tissue and it depends on the level of deterioration. But most of the time, yeah, you can regenerate to a certain extent under any circumstances.
One of the most important query that we often get from the cardiologists of the country is, can we, if an artery is completely blocked by the deposits of erythematous plaques, can we still address this and dissolve the plaques? And
yeah, quite a good question. I get it really often. So there is some formation in the vessel, right?
Yeah.
And people asking, can stem cells help us? Now, stem cells can regenerate the tissue. When the tissue is absent, so to say, or part of the tissue is absent, we can bring cells to build up the tissue back. But when there is a blockage, there is nothing to regenerate. It's already extra material that is inside the vessel. As many cells we give, cells wouldn't take this blockage and bring it somewhere. But with the plaque-X therapy, so plaque-X obviously are not stem cells.
Yeah.
Plaque-X is a phosphatidylcholine-based complex. So plaque-X is able to reduce maybe at least 50% of the obstruction. I think we had good results from 70% of occlusion being decreased to 35.
Oh.
About those numbers. But obviously, after if the occlusion is more than 70%, yeah, it's indication for intervention, for surgical intervention.
Okay. Yeah. Thank you so much. But even 70% is a great number for us to address that plaques or the arterial block. Yeah. Thanks, Doc.
Thank you.
Thank you, Dr. Simon Yefimov, for your insights into metabolic syndrome, have broadened our understanding in the bioregenerative medicine. Now, our next keynote speaker is none other than Dr. Mike Chan, the founder of EW Biomedical Group. Let's explore the neurodevelopment and neurodegenerative conditions from a bioregenerative perspective.
Good morning. We continue on day 2 now, and you've been hearing a lot about the stem cells, and a number of speakers, including myself, was mentioning about the different types of stem cells. And just now, Dr. Simon was mentioning about the mesenchymal stem cells, to what extent they are advantageous, mostly on the tissue, and to what extent it will not do in terms of parenchymal organ repair. So we also have to understand, I did summarize yesterday in a short way that he has 78 organs and different types of cells. Now, this is not my presentation. I think someone had to change it, on neurodevelopmental. Now, bear in mind, the most important thing is giving the right type of stem cells or the right type of peptides, then you will see the results. Otherwise, you will never have the results. And as treating physicians, sometimes not having access to the right type of protocols or the therapies will not render a good result. So at the end of the day, it's important to have the right staff, and this is where the education of EW Biomedical Group and our association from Europe, from USA, and from Switzerland is coming in a big way. I myself have been involved in education for the last 40 years. For the last 40 years, my wife of 44 years together, we have been traveling around the world. I would say I've traveled to more than 70 countries. So I did mention to you, even in India, when we first came in 2005 and 2006, there was no stem cell history there. No one was doing stem cells in those old days. I was in Bangalore, we were travel around, we were moved, and then with Apollo, we were introduced, brought around to create some education, but everything stopped after 2007 because we were so engrossed with other parts of the world. We expanded in a very big way in USA. I'm also very recognized by the Chinese government for biotech, and is working very closely with the Chinese government in terms of biotech and together with the top stem cell scientists of the world. And being a chairman of Regenerative Medicine of Japan, we have a lot of doctors who are very closely working together with us, and the same in Europe because of our close alliance in Europe. I spent 30 over years of my life more than in Europe than in Malaysia, although I'm a Malaysian. Okay. Can someone put the PowerPoint? I think, Ravi, I've given to you the PowerPoint. Yes. So when you talk about neurodevelopmental and neurodegenerative, this is a big issue because I did mention that the brain is coming down fast. Just like all the other organs which is coming in, going down fast, the lifespan, okay? The timeline for the brain is around 65 to 75. It depends on the individual condition of everyone, okay? So that means to say, again, I was saying that the brain cells will go down every day by 10,000 neurons a day after 40. So your memory is coming down, okay? The sign of Alzheimer, the chances of getting Alzheimer, part of dementia is always there for all of us because the brain is going down, it's shrinking down. So of course with lifestyle, if you're drinking and you're smoking, then after 60, the rate of shrinking of the brain will even be 30% faster. So there's so many things you understand. Again, I was mentioning that in the brain with 52 lobes, we have to target the lobes or the type of brain cells with 67 of them. How are we going to do the repair? So when we talk about Parkinson patients, one of the main causes will be the dopamine production, and that is in the substantia nigra. And in the Parkinson patient, the substantia nigra was totally gone. So obviously, you have to rely on the drug, and after some time, the extension of increase on the drug will not work too. So this is where the patient will come down totally. So our job, through our experience, was to give the substantia nigra together with the other types of brain cells involved, and also to revitalize the patient at the same time, because he could be 85 years old, so the other organs are also malfunctioning or coming down. So you have to give all the other organs to do the regeneration because the whole body has to be revitalized. So it's impossible just to give one brain cells or the substantia nigra or the whole brain and the rest of the organ you don't work along. Because you have 12 systems in your body, they have to work synergistically together. So this is where revitalization is needed for all patients of ours, whether they are diabetic or they have a heart problem, they have a kidney problem, or they have some other problems. So you can target the area, but at the same time, you must do a general revitalization, then he feel good. Okay, because the other organs will also pull him down. Of course, the brain and the heart being the two most important organs for us, because heart is vascular, is circulation over the organs, and then the brain is the thing which is controlling all the function and quality life. What's the point of living to 120, but at 75 you're lying in bed? You know, and you do not know what is happening, especially with Alzheimer. You don't even remember the name of the person, but you can see the face within 25 minutes. So what's the point? So what I'm saying yesterday in the lecture was quality life is so important, health span is so important, and that determines the cell span too. That depends on the cell span. I mean, the lifespan depends on the health span, and the health span depends on the cell span. That is the reason why you must do your part in fine-tuning the stem cells in the body, because the depletions of the stem cells in the body was going down so fast that you didn't realize it. Because you are born with 37.2 trillions of life cells. There'll be one stem cells over 10,000 life cells. So the stem cells is the cells which can regenerate. Those are the super cells. The cells don't regenerate much, but the stem cells are the one which can multiply, and division of the cells depends on it. And they regenerate only the targeted cells of the organ. So when you're saying hepatocyte, they will regenerate into hepatocyte. You don't expect the hepatocyte to turn into cardiomyocyte. So that is the reason why we introduce to you some awareness of what unipotent cells or progenitor or precursor cells are all about. If you go to PubMed, you can see thousands of publications by the name of progenitor cells. Okay? But in India and most part of the world, everyone was so engrossed in the mesenchymal cells alone, and everyone organ tissue cells, the answer is no. If someone can do that, then you don't need the iPSC cells. The reality, even for iPSC, induced pluripotent cell, is not happening. It's only in the Petri dish. The reality of iPSC to happen and be real will be maybe 15 to 20 years from now. So while we do not have that technology, our point is if I have to treat the liver, I will give the hepatocyte. I treat the heart, I give the cardiomyoblast. I treat the brain, I need to know which part of the brain for a stroke patient, and you give that part of the cells to do the repair. So that is the way. In other words, that also opened the question of some physician asking us, do I need to store the cells then? You know, we talk about cord blood banking. Do I need to store the cells if I can have access to the cell at any one time when I need it? Let me tell you, the storage of cord blood banking was a brilliant American business idea. Okay? So they give the idea that you can store the cells, but what you're storing are only the tissue cells. You're only storing the hematopoietic cells and the mesenchymal cells. You didn't store the hepatocyte or the cardiomyoblast. And the reality of being able to use the cells, it could be 1:7,500 for your siblings, among the siblings of the donor, and among the parents, it could be even 15,000, 1 in 15,000. And the chances, even to store the cells, in reality, one day you need to use it. Let's say in the case of leukemia for a donor, you know, the baby is 30 years old later and he has leukemia, and you think you have enough wires to expand the cells, you may not have enough too. In fact, in Europe, there was no storage of cells. Cord blood banking was never existing in Europe, for your information. Okay? Because according to the councils, you can't sell blood for money in Europe. This is just some facts I'm telling you. Of course, in India, in Asia, most of the part of the world, especially in Asia, a lot of companies make good money with just the storage, and it's cheap nitrogen tank to do the storage, and they charge you by the wire. Especially in Hong Kong, I was so stunned to find out that they even have to pay 80,000 US to do a storage. It's crazy, okay? So with new developments, there's always an access. What I'm trying to say is if the patient needs any types of cells, including the 400 or different types of cells, we can actually procure them and culture them within 14 days. You will have those cells. Any type of cells you can name it, okay? Again, being one of the experts or the pioneers doing with human stem cells since the 80s, we have done a lot of research. We have done a lot of publication, even with mesenchymal cells, okay, human, okay? But we also have to open the idea of when we treat the untreatable. There's certain organs you need, like the renal cells for CKD patient. Then obviously you must give the renal cells. You can still give the mesenchymal cells exactly like what Dr. Simon was saying, the parenchymal signaling effect to stimulate, but you only stimulate the cell membrane of the cells. You didn't went to the nucleus of the cells. And I gave the idea that to go into the nucleus of the cells, every cells, all the 400 or different types of cells you have in your body, okay, including the organ, or I call it the parenchymal organ cells, the organ-specific and the brain-specific cells, although the brain is also one of the organs, is that they must have the same molecules. None of the cells have a different molecule, just like the fingerprint. Even twins have different fingerprints. Again, you must have the same amino acid. Again, you must have the same proteins. None of the cells has the same proteins. So these are the three elements we must understand. Otherwise, everyone will say, I give you an A, I will treat diabetes, I will treat heart problem, I treat kidney problem, I treat everything. Impossible. Okay? So I stress that it must be a A1 for A1 problem, a B6 cells for B6 organ, a Z10 cells or stem cells or peptide for Z10 problem. So that is the way we have to go. And that is the right way to treat. Along the way, you can blend along with the peptides, you can blend along with the plant, or you can blend along with whatever, as long as you help the patient. Even if Ayurveda can help the patient, why not? The job of the physician is to make sure the patient feel good and they see results. Otherwise, you can't sustain your business if you're running your own clinic. This is how I'm thinking, because I'm running 46 hospitals and clinics around the world. And the first thing the patient will always ask is, can you guarantee? What is the percentage of treatment? What is the result? Everyone will ask the same question. And it's so difficult for the physician sometimes to answer, even for kidney patients. What you can do for one kidney at stage 5 or stage 4, and he recovered, doesn't mean you can do another one with a similar problem. Okay? So we have to look into all the spectrums, all the different spectrum of the patient. Okay, this is very important. Now, although my topic today was on neurodevelopmental and neurodegenerative, it was meant to be given by Dr. Yuri, but he couldn't make it at the last minute, so I had to take over and present it in a different way. So it is important to understand, throughout my journey, dealing with 80,000 physicians of the world, we are talking about 80,000, that means it's a lot, because we do the production, we do the research, we do the publication, we do the education. We don't have a sales and marketing team for your information. In Malaysia, we have 400 staff. And outside of Malaysia, we have thousands of employees with a few hundred doctors in our clinical team. We do not have a single sales and marketing team. So how are we going to create the awareness to the doctors, and how do we distribute to the doctors? We actually go by education, because I believe education is the best way. They are aware of the right way to treat. Otherwise, no one knows what's the best way to treat. So we had to put everyone together, and that was the reason why I molded the idea to Ravi. India itself, being the country with the most amount of doctors and most amount of patients, okay, it's high time to have a body to provide free education to the doctors. Because you need to train the doctors. Okay, the doctors will have to retrain their juniors again, and we go on. You cannot rely on a few persons in this world. It's exactly like what our team is doing. You know, we go around the world. Let me tell you, we're going around the world. After this trip, I'm going to Dubai. After Dubai, we're going to another place, and our doctors are all traveling around the world. Okay. So coming back to what we have here, we learn from the mistakes, we learn from the failures, we learn from the non-results of what we see, and we also learn from the success of the results. We hear from the doctors, we hear from the patient themselves, okay? And that's how we group it up, but I was the guy in the early stage who formed the world's first stem cell association. It was 2006 in USA. When we mold the idea, when we introduced stem cells in a big way into USA, and even the exosomes to USA and the world, that was very early. We are talking about in the early years. When we brought stem cells in the 90s to Asia, no one even understood what is stem cells, even in Australia or even in Japan or Korea or China. Those are too early days to talk about stem cells. Okay, it's the same in India in those days. Okay, but I come to realize the only way is education. So we, with the education and putting all of you together, okay, that means you can ask the question in the group. We have to create a Bible for India itself. There must be a Bible. Someone asks a question and everyone will look at the question and is of interest, they will pick it up too. Again, along the way, you will be asking additional questions. All these questions will be answered along the way. And this is how we learn along with each other. Okay. So I was trained by one of the top people in stem cell research. The father of cell therapy, Paul Nihans himself, you know, he has two partners. They are called Frank Smith and Albert Landsberger. Albert Landsberger was the professor in Heidelberg University for the last 40 years. He just passed away a few years ago. I was trained by him. I was also trained by the master in thymus therapy, the German guy of Milan Pesic, who started with Sandberg. Today, our company is the world's largest manufacturer of thymus peptides, raw materials, or we call them API, active pharmaceutical ingredients. Okay, what is so important about thymus? We all know it's for the immune system. It's also meant for autoimmune. There are thousands of publications there, down there, especially with the Germans. Although they're in Germans, they're not so recognized by the Americans, but I always say physicians must open up. Don't just look at UK or don't just look at USA. We have to look into Japan. What are they doing? We have to look into China. We have to look into what other neighbors are doing. We have to look into Europe. There's a lot of high-end things in Europe which is not probably allowed in USA, but that doesn't mean it's not allowed in Europe. Example, cerebral lysins, made from pig's brain, has been approved and used for the last 60 years in Europe. It was made in Austria for Alzheimer patients. Until today, it's not approved in many parts of the world because US FDA didn't approve it. So are we going to say it's not approved? No. A lot of patients are buying them. The Americans, doctors are ordering them illegally still because they don't have the means to provide the right solution for the patient. And again, in my experience, okay, I've tried so many of the brain stuff because I think the most important thing as you age is your brain. You're as young and as old as your brain. So I make sure I supplement myself with the brain peptides. I do inject the brain stem cell peptides of CNS. Okay, sometimes I will add the frontal lobe there because I'm so afraid of losing the memory. I'm just giving you my secret formula myself. I only sleep 4 hours a day. But 1 hour is inside the hyperbaric cabin. We introduced a hyperbaric cabin in the 90s, early 90s in Asia. So there's a lot of things we have to understand here. Okay, so my latest years was spent with MIT. I was working with the youngest professor and the oldest professor at MIT. His name is Clark Colton. He's in the top 50 of the world. When I first met him, he said, I know everything about stem cells. Imagine I'm in MIT since I was 27 as a professor, the youngest, and now I'm in my 80s. So obviously has been doing a lot in stem cell research, okay? And he came out, when I explain on anything, he will cite the book and he can tell you what page. That means it's good, okay? But he was a master in mesenchymal cells. He wasn't a master in other types of stem cells when we talk about xenografts. So when I was given a chance to meet him, you know, he said, I only give you 30 minutes, Mike. My time is expensive. It's $600 per 30 minutes, US. And since you're coming from my student, who is a chief scientist of Life Extension, which is one of the well-known body, and he's also part of my team, Dr. Ern, I will give you a time. But it's 10:30 p.m. at night on a Saturday. Imagine Saturday, 10:30 at night in the university. It's totally dark. And he don't even look at me and say, I only give you 30 minutes. And eventually, I looked into what he has. I gave him the idea. When you stimulate the kidney, because I realized he had a kidney problem. Okay, one of his kidneys is not working. I gave him the idea. You should be using the mesenchymal cells, which provide the epithelial cells, but you still need the kidney cells. And I gave him the kidney peptide a few weeks later. He tried and he liked it very much. And that's how he had faith in what we are doing at the end of the day. You know? So the moral of the story is that you cannot specialize in only one type of stem cells. You must specialize in all types of stem cells. And they are even stem cells with the plant. Do understand that. All living things have stem cells, otherwise they cannot regenerate and they will die. And we are talking about so much of regenerative medicine which was not taught in medical school. So when you say regenerative means you really must regenerate the organs. And in the previous lecture of Dr. Simon, someone asked a question about the arteries. Now, as long as they are living tissues, you obviously can regenerate. If they're scar tissue, there's nothing you can do. Okay, but it's already dead tissues. So as long as they're living tissues, even with dying organs, you can regenerate. So that is the thing I'm trying to stress here. So with regenerative medicine, which is the future of medicine, in a way, and stem cell is very much a part of regenerative medicine. I sincerely think we have to put a lot of focus here. And a lot of education has been put in here. Now, stem cell is only a small part of regenerative medicine. There's so many other therapies along the way. Okay? So we have to open up, but if you can combine everything together, that means you have the best. It's like Bruce Lee learning Kung Fu. He only learned the Wing Chun from Yip Man at 17 years old. He was already a street fighter as a child. You think he don't learn from everyone? He was dancing around and he heard about he saw Muhammad Ali dancing around the rope. So this is what I'm trying to stress the idea. All the physicians will never be the best physician. None of us will be the best. But we can be one of the best by being weighed together with some of the best. So it's high time for us to group together, learn from each other, solve the problem together, think of the best protocols for the disease. So I will always say the untreatable doesn't mean we're going to ignore them totally. We also have to find a solution to treat the untreatable. There's so many untreatables, including autoimmune problems. So if you think the stem cell alone can treat the autoimmune well, my personal answer will be no. You can't rely only on the stem cell to treat the autoimmune. But in the case of autoimmune problem like multiple sclerosis or with RA, there are some damage to the organs. So obviously you need the stem cells to target the organ and treat the organ. That is the way to treat. But still you have not solved the autoimmune problem, which Dr. D did present on the autoimmune yesterday. We had to reboot the system because it was an overactive immune system. If there was a problem with the overactive immune system, so obviously you had to do something. What we have learned, and we have patented 10 patents on this, which we learned from our Austrian master, was to take the Buffy coat from the serum of the patients, which contain the DNA of the immune system, and we create a vaccine for that particular patient. We have done so much on psoriasis patient here, because my own son, my elder son, was a chronic eczema patient. He's a Chinese boy, I have 3 sons. And imagine he's as dark as an Indian. My elder son. He has a fair skin, but when he developed, he was an asthmatic child, after 14, he started to have a small patch on the head, and then the whole body is with scab. When I apply aqueous cream on his body, it cuts my palm. Can you imagine how bad it is? And being an authority with my wife in stem cell research, sometimes we feel ourselves helpless. Because people will ask me a question, Mike, you say you can do stem cells so well. I see your son is having psoriasis. And he covered himself with sunglasses going to school without a single sight of his fingers or skin. And every private school allowed that. He changed 5 private schools. Because the school is also trying to kick him out and do not want to accept him. Even if you're a private school, so what? They don't want you, you know. So I have been sending a lot and paying a lot of top dermatologists of the world come to Malaysia and treat my own son. There wasn't any solution. It went on for many years. So obviously I have a low self-esteem too, okay? And the only way I can dig through, I remember a movie called Lorenzo Oil. You know, when I was in the early 80s, it was a very old movie where the parents find a solution. So Michelle, my wife, and I decided to go on that route. We dig up all the files of masters, and we came up with the autologous active specific immunotherapy together. Today, we have more than 10 publications on cancer patients and also on psoriasis. That is some of the story I'm telling you. A lot of things are inspired by real situation, including on treatment of diabetes. Why we come out with a situation of target giving the islet cells of the pancreas. I mentioned that the pancreas is 13 different types of cells and stem cells. If you can isolate the alpha, beta, delta, exocrine pancreas and treat the diabetic patient, that is the solution. So that is what we are doing. We are going into so precise in the word precision medicine. This is the real precision medicine because you do the isolation and you give only that particular cells. So again, with the liver, it was the same situation because diabetic patients will also have the liver problem. So we isolate the hepatocyte from the rest of the other 75 cells found in the liver. The liver is a dustbin. All the cells will be there. If you can isolate and give the hepatocyte that would be the best thing for fatty liver, the best thing for all kinds of liver diseases, and that is exactly what we are doing. So that was a solution which was a dedication for my own father, a very educated man, but he died very young. He died at 56 due to complication of diabetes. And he had a complication with the liver and the rest of the other problem, and he died suffering. So we were looking for the solution, and the other inspiration came from my own father-in-law who treated me very much. He was on hypertensive drugs. Again, he killed his kidney. So that is the reason why we focus so much on the liver and the kidney in our early days. We went back and spent all the time in Switzerland and Germany with this. And of course, together with the Soviets, we learned a lot of things because the Ukrainians or the Russians are the master in stem cells, not the Americans. Americans are very far behind in stem cell research. I always say that because when I first go to US, I told them you're very far behind because you're still using the UPC, you're still talking about young plasma, you're still talking about PRP. Those are very young, old technology that has been done in Europe for many years, 25, 30 years ago. You know. So there's a lot of things we have to open up. We must open up. We learn from each other, we open up. I've been in the government front cover of the Chinese government magazine, the oldest magazine, front cover, and in the 6 stamps of my face was found by the Chinese government postal office for my contribution in terms of education and biotechnology. Okay, although I'm not a Chinese, but the Chinese like to recognize me as part of China. So I have nothing to lose because my grandfather come from China. I do learn from most of the people there too. So these are some of the pictures we have all over the world. We can prove it as early as even the 1980s where we do education. Even for India, in the early part, I came over here to Bangalore a few times, and we were brought around to do education at that time. But everything dies off after that. So it's high time we have to work with the right partners. We must work with the association, the medical association. We must come together in a good way and provide all the education and the awareness, you know, of what is happening in the rest of the world. It's high time to look into what is happening. And the good part is that we have all the clinical experience here. These are our own hospitals. We own them around the world. From Germany to Lugano, Switzerland, to Athens, to Santorini, all over the world. So it's high time that we must do something in India, go with the education, work with the clinicians, share the knowledge, and go into manufacturing on a long-term basis because that is the only way to cut the cost. Not everyone in a big India can afford the stem cells. We all know that. In every country, it's the same. It's the same. Someone did ask me, Mike, why do you set up a 40,000 square feet in Bangladesh a few years ago? It was the poorest country, and you set it up there. No one realized, even in a smaller country of Bangladesh compared to India, there's still a lot of people who can afford the stem cells, and they need them. They still can pay for it, you'll be surprised. So what about India? But we must consider not just to treat the rich alone. We must make it affordable. The only way to make it affordable is to do the production here. Bring the Europeans down here, set up a European therapy, set up a German manufacturing plant here, and work with the locals, train them up, do the production, but protect the IP. That is the way to go. And at the same time, the education must move first. Because at the end of the day, you can say how good you are, but if you don't deliver the result, you can't sustain the business. I always insist we have to be result-orientated. Otherwise, you don't get the results, means you can't stay. No one will believe what you're talking about. So it's not just a testimonial. The publication had to come in, the books had to come in. That's the reason why we wrote so many books. We are not making a single money from the book for your information. It is meant for education. You can't make money from education. So with the 46 centers we have, that means you can think of any specialist. We have them. We have to work together, whether you're a cardiologist, you're a hepatologist, you're a nephrologist, it doesn't matter. Or even when you want to talk about immunotherapy with cancer therapy, it is something we have to work together. There are solutions. It's not just the chemo or radio. In Germany, hyperthermia is a must. And again, the first thing they look into you is not for chemo or radio. The first thing they give for the patient is your immune system. super boosting the immune system with thymus therapy and super transfer factors. That's what we have been doing all along, okay? Because we run a German hospital too for cancer patients. Only cancer patients. All the patients are cancer patients. But a lot of modalities are allowed in Germany compared to the Commonwealth countries. Because I'm a Malaysian. Malaysia is also a Commonwealth country. So there are a lot of limitations too, okay? But the rest of the world, I did mention like Japan or even Indonesia or even in Korea, they're opening up certain parts. Even in China, they select an island called Hainan Island. Any one of you can practice there and do the stem cells there. Only in Hainan Island. So you have to fly to Hainan Island. But still there is a place to do it. And economically, it would be best for the government. Because the rich is going to spend a lot of money outside the world. The first thing someone has the money, I would say, I go to Europe, I go to USA. And that's where they spend the money. And there's a lot of rich Indians who are spending a lot of money in Dubai too, because a lot of good hospitals are in Dubai. Imagine the amount of money leaving India. So we are trying to tell the government that, of all governments of the world, the big countries, the main cost is health cost. If you can think of a solution where you can cut down on dialysis, where the patient don't need to go for the dialysis, by repairing, giving the renal cells and stop them from having dialysis to a certain extent, you're going to save a lot of health costs. What about diabetic drugs? It's getting expensive. Of course, I know India have a lot of generic drugs. But at the end of the day, the drugs itself is going to kill the kidney. The kidney is only 55 years old, 50 to 55 years old. So everything you're taking, even including supplements you don't need, is going to have a toll on your kidney. What about your pancreas? Again, it's 55 years old. What about your stomach, intestinal mucosa? It's also 50 to 55. Looks like so many things around there. Your heart is 40. Okay, and I also say your heart at 70 is half the function of a 30-year-old. So you are again losing your hormones at 1 to 2% after 40. Are you going to say you're totally healthy after 70? No, it's difficult. So that is the way we have to go around. This is a 100-year-old hospital. Okay, you'll be surprised. We only treat patients for wellness here. Okay, and has been there for 100 years. This is a cancer hospital. I'm just giving a rough idea of what we have here. This is our center in Athens. We own them. It's a medical centers. Certain parts of Europe are more open, so we have to look into that. Okay, if certain countries are more open, means there are a lot of liberation in what you have to do. Okay, so again in India, I hope the authority will support. You see, we have in Europe a word called individualized therapy, especially in Switzerland and Germany. The treating physician will treat the particular patient and prescribe the modality of treatments and the concoctions of cells and stem cells only for that patient. In India, you have these two. But I think the bureaucratic side, we have to think of some solution. Exactly what Dr. Ravi was telling me. He said that in India, we have to apply case by case. And by the time the approval, it may take time. So it's high time to work together. Maybe the association, the medical association, can negotiate and do a proper negotiation with the government on all this. But the first thing is, I sincerely think, I told the Malaysian government too, because I was employed by the Malaysian government to head Southeast Asia, all the 11 countries, including Singapore, to draft the guideline on stem cells in Malaysia. And China was drafting their own guideline, so we were working together. I was working together with the Chinese people in guiding the stem cell guideline. So there's a lot of things. And one of my ideas was the doctors must be trained and certified. If you certify the doctors to be able to give training, and they know what is stem cells all about, and they will be the responsibility of the association, then it can be done easily. So it's the same in Japan. Yeah. 12 more minutes, then I go very fast. Okay, we can go later with the Q&A. Okay, I'm so engrossed. Okay, I'm so engrossed with education because that is the way to move. And we must work with the Indian Medical Association on this. We need you guys to work together. I work with 10 medical associations in Philippines out of the 11. So these are centers and all this. Okay, we move very fast. Now this is something I like to tell the world. We introduced the world, the first handbook last year, on anti-aging medicine written by 40 professors. We are going to come out with another one on longevity. We want to involve the Indian doctors here in research in the future coming months. We would like to invite some of you to be part of our scientific team, move into the research, move into the education at the same time. So even in terms of autism, we have treated so many on autism. I use the word thousands and thousands. Every day we have autistic children all over the world. So Heidelberg is a good part where we have been together for 40 years. I told you yesterday I'm an autistic child myself. So that is why I do have a lot of experience together with my wife in my dedication to autism. Many years ago, it was 600:1. Today, it is in US, it's 1:36, so it's a big figure and an alarming figure. Even in a big country like China, the Chinese government told us they have 30 million autistic children. It will be the same in India too. Okay, same in Vietnam. Okay, so again, the brain is important. Give the targeted brain cells. When we have autistic children, what is the big problem? The social problem. But apart from the social problem, which deal with emotion, so the hippocampus is needed, okay, apart from other brain cells. But the main cells is concentration. They don't have concentration, they don't have eye contact. So obviously, you must give the frontal lobe then. Okay, so you must give the frontal lobe. Oh, so this is what we give, basically along for the autistic children, but everyone has a different spectrum. We all know that. So you must target to which part of the brain and give the right part, okay? And I did mention the timeline of the brain. This is what the brain is happening. It's shrinking, okay? The neurons are going off. I said 10,000 neurons are dying after 40. So you have to be careful of the brain too, you know? So in terms of autistic children, we continue to like what we're doing, and this will be one of our main CSR in India for the European Wellness Biomedical Group. We must help the children because they'll be the leaders, they could be the leaders of the country. Okay, we must help our own children. And my own story, I have 3 sons, my second son is an autistic child. So I did have a tough time taking care of him. Today he's independent in Australia. He finished psychology, he went to nutrition on his own. So we did have a success treating my own son, an autistic child. That is important, okay? And we didn't rely him on any drugs at all. I do not believe that. We have a lot of good experience treating bipolar and psychiatric patients, mental patients, and we take away the drugs. We don't need the drugs, okay? Because the psychiatric drugs has been there for 200 years. It's the same formula. You have to understand. There must be changes. The right way to treat, like what India is as a holistic country all along, is treat it holistically. That is the way to move, okay? So coming back to similarities, I will always say autistic children in their later life will also have a high risk of Parkinson. And Down syndrome children in their later life will also have a problem with Alzheimer's. So these are some of the things we have to think about, you know. So everything is through the brain. I'm going very fast because this lecture is very long. I didn't realize I have so short time, you know. So we look at the problem, we look at the attack scores, we will analyze it from there. Because not all the child have the MRI for us. But sometimes you don't need the MRI, okay? If you look at the functional test of the child, when the parents fill it up, we can also rank accordingly and what other type of cells to give. Because you basically know what is wrong with the child when you look at the child, okay? So in the case of other spectrum, we put them all under ASD. But none of the children will have the same type of exact cells together. Everyone has a different number of cells. And I told you it's a daily affair. This is what is happening. We have patients coming from China all the time. We have patients coming from the Middle East, in fact, all the time. We even have patients coming from America. So again, you can think of all the other occupational therapy for autistic children. But sometimes it's difficult because I heard it from the specialists who tell me, hey, I did my best, but again, the child is difficult because the attention is not there. It's true. If you don't stimulate and give the frontal lobe, and he don't focus, how are you going to give him the training? It's not easy. If you don't give him something for the brain, for the speech, it's also not easy to give the speech training. So all you have to do is to stimulate which part of the brain, then he will go along with occupational therapy. And all these children, anything to do with brain, you need the hyperbaric treatment along the way to, and it will be good. And Dr. D was mentioning about IVL lasers, which go along, and it is very much for the older autistic children. Our oldest patient was a 32-year-old lady, which we treated in January before Chinese New Year. And 1.5 months later, the mother told us, the mother is the president of Autistic Society. He never imagined her child would be treated at 32. She came to us because her brother had stroke, and we treated the brother with the right type of brain cells, and the brother recovered very well, and she brought her own daughter, not expecting much thing because she's already 32. And we told her our oldest patient was 28. We had treated a few of them, but this was on record. Within 1.5 months, she improved so much. And I was treating 3 autistic children sent by the royal family 2 weeks ago, and before in Malaysia. Within 1.5 weeks, everything was so changing so much. I'm asked to go and meet the royals after this trip. I'm going there in 2 days' time, you know. So there's a lot of things ongoing. And we come to realize that the right brain cells is important, but of course, in case of some patients who say, I cannot afford the stem cells, Mike, then we have to give the peptides. The peptides have to come in then, okay? Because I also told you that the peptides are 20 times cheaper than the stem cells. So this is where you have to give the peptides. And someone was saying, oh, why don't we use the exosomes? They will cross the BBB, you know, and then the exosome will cross it. But again, you have to understand, all cells and stem cells has the waste material, which is called the exosome. They emit the waste material. You can call them secretones or exosomes. They mean the same thing. So when you give the cells, you've already been giving the exosomes. That is a good part. But in India, a lot of people were saying, some of the doctors, I buy it from Korea, they saw it plant-based, okay? And again, even if they have, it will be mesenchymal cells derived. But what I'm trying to tell you is, along with the cells of 400 over different types, you can also have exosomes or peptides, which are 400 over types. And will the peptides work better than the exosome? Yes, of course. The concentration is stronger. So the peptides is cheaper too. Okay, so this is something we have to understand. We have a journal publication in UK and ASD for some time. So this is one of our book. It's a medical textbook, and things are moving. And early on, we have a lot. There's so many testimonials for your information. Please go to the website, look at the testimonials. A lot of them are coming from America. It's difficult to get testimonials from America, and we never ask for testimonial. It's the patient who are happy, they give it. You know, so this was another difficult case. This boy has a violent nature. He came all the way from US, referred by an American doctor who tried all the kinds of stem cells. It didn't work for him because he was given mesenchymal cells. He has a violent nature. That is difficult. Okay, I toned him down after the first treatment, and they are so happy. Okay, he's the only child of a very well-to-do family, so that was good. And there was another difficult case we just treated recently, 5 months or 6 months ago in USA. He's 24. And things are moving very good, and he improved tremendously. The picture you saw is just exactly after injecting the stem cells. This is the second time when he did it, and it was in USA. So again, with China, there's so many of them, so many, because I was invited by the Chinese government on this, okay? So I'm moving very fast because I see you coming in, okay? These are from the Vietnamese side. We did a lot with the association. We must work with the association in terms of autism and special needs children. This is where we create all the education to the parents. It's not just the education to the physician, it's also to the parents. Because the parents themselves do not know how to take care of them. If you go to Dubai, there are more than 50 private schools. The parents have paid the money, and then they expect everything to be done by the school. Private school, they spend a lot of money. But that is not the right way to treat the patient, the child. The parents have to understand the child too, because they are the people. This is sent by the Thai King. The Thai King is 64 autistic school and special needs school. He sent one school to us to be treated, and we treated them with good results. And I'm also going to Thailand because of this. So there's so many other things, so many other treatments. Along the way is the same with the Down syndrome. If you can treat Down syndrome children, which is with a very low IQ, you obviously can do the others, because it's also with the brain. Okay, so look at the face of the person. The face is the IQ of the person. The expression is everything is on the face. Look at how they changed the boy from 1 year old, 1 year of treatment from 9.5 to 10.5 is only 1 year. Look at his face, he changed so much. Okay, in Malaysia, we have treated 600 of them, and that is where the king gave me a title for that, you know. It was called Dato Sri, which is equal to what the current Prime Minister has the title as, for our contribution of treating Down syndrome and autistic children. And this girl is 51 years old. She's a daughter of Frank Smith himself, okay? A daughter of one of the partner of Frank Smith himself. And he's American, he's independent, she ran her own business, okay? And she was treated when she was at a very late stage on down. So there are solutions, I would like to say. There are so many solutions. I'd like to do the same here. So we can do the same for intellectual delay or global delay development children or whatever, anything to do with the brain. We love the brain. We love to treat the brain. So moving part, okay, same with cerebral palsy. Again, you will notice there's also many other celebrities with cerebral palsy, and yet there's a solution. Same with autism. I told you even Elon Musk is autistic, you know, even Bill Gates is autistic, Isaac Newton, Albert Einstein is autistic, Beethoven is autistic. So there are solutions for all this. Give the right thing, the brain cells. Without the brain cells, nothing works better. So when we come back to Parkinson, we know a lot of fellows having Parkinson, and it is also a risk where some of us will have on a certain time. So we must cut the dopamine, and our experience is to cut the dopamine not immediately. Even for the diabetic drugs for diabetic patients, you can't have a sudden withdrawal, but you can reduce over time. So we monitor after 4 months of the treatments, and our experience with some of the Parkinson patients was to reduce the drug. There was one instance we reduced it up to 70%. That means you reduce the drug intake over time. Long term is to cut down the effect of the drug. Okay, so it's the same for Alzheimer patients. Okay, we have done so much on Alzheimer in US. Every month we are flown down to US to treat a number of billionaires for having Alzheimer. They have all the money in the world, all the billions, but they have a big problem. They can't solve their Alzheimer patients. I mean, there are Alzheimer problems, and they're paying a lot of millions in USA for a solution. They couldn't get that. And along came us, we say it's easy. Give the right brain cells, and that's where they see the good results. And that's the reason why I have to go to US every month. And I just been to US 3 times the last 30 days. It's crazy, okay? Because there was a lot of good demands on all this. So just tell me what you need. We will do our best here to provide the best for India, because our job is to save life and enrich life. But for that, I sincerely think education is important. I always say you throw 10 darts into the dartboard, all the darts must hit bullseye. Then you see good results. If you do a proper diagnosis properly of the patient, analyze everything, do the detoxification. If there are heavy metals, you have to take them out. If there's some other excessive lipid, you take them out. You do the repair after that. So diagnose, detox, repair, and then you do the regeneration with the stem cells or the peptides. It works wonderfully well. And this is in the book which I mentioned on biological wellness, is there. And Deepak Chopra was a guy who mentioned this is a must-have book, you know, and he bought the book. So again, Dr. Simon was mentioning about the multipotent cells and the limitation and what goes after the multipotent cells. This is a publication we went for Cambridge last year. Everyone was showing this. No one showed this part on the unipotent cells. This is where I'm telling you, this is another part of the cells which is forgotten for 400 over different types of them. Okay, yes.
Sorry, Chief.
Okay.
Dr. Taslim, I wanted to speak to you on the line.
Okay, I'll finish it in 3 minutes. Okay, yeah. So these are the chart. You need them, you contact me. I'm willing to share it to any one of you here. Okay, because of the time. Okay, you need any information, please text us. We are willing to provide all this information. We can provide you the protocols without any obligations. Okay, education is important and it's imminent. Thank you so much, everyone.
Guys, right now Dr. Taslim Arif is on the line with us. If to those who does not know him, he is the CEO of the Center for Cellular and Molecular Research in Bangalore, which is housing almost 4 Nobel laureates that are responsible for groundbreaking technologies and innovations in India and abroad. So he's the one who wanted to collaborate with us when it comes to bringing this technology of the state-of-the-art bioregenerative medicine. And last time during our visit to India, myself and Datashri happened to have visited their facility, whether it houses all the toys we need to ensure that we can bring this research to India as well, so that we can substantiate the claims with the data. So right now, the Indian government has allocated 3 research incubators for us. One of them is the Center for Cellular and Molecular Research in C-Camp, Bangalore, and the other one is CCMB, Hyderabad, and the other one is IIIT, Hyderabad again. So right now, I would like to, Pranit, can you please ensure Dr. Taslim Arif is on the screen? Yeah.
Hi. Good afternoon. Can you hear me?
Yeah, who's this? Yes, Dr. Taslim.
Can you hear
Yes,
me?
yes, we can hear you. Can you hear us, Dr. Taslim? Hello everyone. To those who does not know about Dr. Ramchandra, he the nicest human being he can be, and so humblest and modest person. He is the president of the Telangana chapter of the IMA, and he's one of the famous interventional cardiologists in the country. And he's also the chairman and director of Shri Shri Holistic Hospitals, who has its footprint and the presence in both Andhra and Telangana. And I would like Dr. Ramchandra Garu to, first of all, he had a lecture today to address our audience, number one. And number two, what I would rather ask him to start with a small intro of his accomplishments and how he see the technologies coming into in order, because as far as I know, he's an ardent believer of preventive care and ensuring that he has to attack the disease in every layer possible so that the patient will have a finest, patient is promised a quality lifestyle in every way possible. So, yeah, Dr. Ramchandra Garu, if you can, Doctor, you want to address him? Or shall we take? Okay, so I would rather now pass the mic to Dr. Ramchandra Garu.
Thank you, Dr. Ravi and Dr. Mike. Actually, I studied in Orissa, which is a neighboring state here. I did my MBBS and MD and everything there. Then I went to Manipal to do my DM. And then I went to US and did 3 fellowships and actually was working there, but I came back to work in Puttaparthi here. It's a very unique hospital in the sense that it's an absolutely free hospital. It does not have a billing section. And even you can get your heart surgeries done without even donating blood, because the guys there donate blood for you also. So it was a very unique hospital, but there were some problems and I joined other hospitals. And then after working for many years here, we started our own. There was a group of doctors that started it was sort of a wellness group. Like the European wellness, of course, we didn't have all the technology. But we believed that yoga as a technology has a very universal role to play. Whether you're talking about neuroplasticity or genetics or epigenetics, it's very clear. The way Indians look is, everything is perceived in the mind. So whatever you perceive here is in the mind. Not only that, they tell you that whatever exists outside is also your mind's creation. So it's an amazing thing. If you look at Einstein's theory of relativity, and it says that time is plastic, maybe it is true that whatever we perceive is what exists there. Maybe there's nothing else there apart from that. So yoga as a tool to produce those sort of modifications can have a huge influence. So we started this allopathic center. We knew that we needed a proper allopathic center with all sorts of technology, like you need to do bypass surgeries, you need to do transplants, everything needs to be there. At the same time, you need to integrate it with Ayurveda and yoga. And so we had this concept of a longevity center, basically where you promote longevity so that people can live much longer. As you know, in the last 10 years, the life expectancy in India has increased by 10 years. And as you get older and older, as the population ages, some things like your regenerative medicine as well as preventive care become very important, because you don't want a huge section of old people who are very sick. They will not only deplete your resources, but they will deplete everybody's energies also. So you need to keep them healthy. It's not just longevity, you need them to be healthy also later on in life. Till the very end, they need to be productive and healthy. And so this was the concept of longevity. So we did it to some part in our holistic hospitals. Our hospital's name itself is holistic. Sri Sri, because we are followers of Sri Sri Ravi Shankar. He's a yoga guru here. And we try to inculcate all his programs, his Kriya. They have wonderful things like they have a spine care program. They have something called Padma Sadhana. So for example, if a person comes with, low back pain, once the allopathic doctor sees and says that, okay, he is not having a severe disc prolapse or whatever, then you can send him to the yoga guy who does this spine care program. So it incorporates a lot of things. It incorporates yoga, it incorporates some physical exercises, physiotherapy, as well as some amount of allopathic care. So basically, this is the holistic care. Because allopathy itself cannot address so many problems. So this is something very, very important, that allopathy can address only most probably 1/3 of the disease spectrum that is present in this country. So, but at the same time, allopathy has techniques that can produce miraculous changes. For example, if you look at coronary artery disease, as far as we know, there is no reversal of coronary artery disease. Once cholesterol gets deposited in those arteries, there is no technology that can reverse it. Of course, Dr. Mike could be having some of those, his peptides that can reverse coronary artery disease. But the only thing we know is, a few years back, they gave a HDL preparation intravenously, and they could actually regress those plaques. But otherwise, there is no plaque regression. But the father of cardiology, Dr. Eugene Braunwald, is now talking about giving a drug called inclisiran, which is a drug that lowers cholesterol every year, like a flu shot, from the age of 40 years. And if you do that, you can push the clinical manifestation of heart attacks to an age of 120 years, which means you can almost eradicate heart attacks globally by giving a yearly shot of this drug. So what I want to say is these technologies are on the anvil, means they are almost there for us. It is just for people to explore. The other problem is there are already technologies which are not encouraged by many people. For example, around 20 years ago, there was a picture in the American Heart Association journal where people in China are having open heart surgery fully awake by acupuncture. So you have these photographs where it tells you that it works. But then nobody, looks at acupuncture like that, like as a tool where you can use instead of anesthesia. Because, maybe there's not much money in it. So what I want to tell is there are a lot of unexplored technologies in this world already existent, already being developed by pioneers like you, which have to be taken up by us. So one thing about India is it is the global capital of all lifestyle diseases now. So what has happened, it was the global capital of infectious diseases. Now I think it's become the global capital of all lifestyle diseases also. Like right here in this state, maybe this is the global capital of diabetes, hypertension, heart attacks. In India, heart attacks happened 20 years earlier. The statistics is almost half of all heart attacks happen in people who are less than 50s, which means they are in their 40s. A quarter of all heart attacks in India happen when the person is less than 40s, which means they are in the 30s. So almost 20 years younger than the West. So with this huge population sitting here, which has a very premature disease pattern, I think prevention is very, very important, the way we look at prevention. And we need to tackle it. That's what we was talking with Dr. Ravi yesterday. We need to tackle it from all directions, which means not just be stuck with one thing, not just be stuck with your medicines or with your diagnostics or with Ayurveda or with yoga, but with things like regenerative medicine, use whatever technology you use, because you need to attack it from all prongs. So we welcome the European Wellness platform, welcome especially Dr. Mike, Dr. Ravi, and we would like to collaborate with them whichever way possible to see if we can give something to our people here, because I strongly feel that this is a very sick population. Something needs to be done on all fronts, prevention as well as regenerative fronts. So we welcome you here, and we hope we can collaborate with you in whatever way is possible. And I'm sure our medical fraternity also, they're always willing to cooperate. Indians are never dogmatic about anything. I think they take anything that comes. Of course, it has to be rational. And the country has a scope for everyone and everything. That's what I was telling Ravi yesterday. Our middle class is bigger than the US population, and it's almost going to be as affluent as them. So this is a huge, huge population waiting here. So this is no longer a poor country. This is a rich country if you look at the total number of people and the middle class that is there. Middle class is educated and can take in treatment like yours. So we welcome you here, and we hope you will make a huge change in the health structure of our country. Thank you.
Thank you, Dr. Ramachandra, for sharing your achievements and insights regarding the subject. Now I'd like to invite Dr. Ravi and Dr. Mike to present a bouquet to Dr. Jaikumar Jaipal, Chairman of Indian Medical Association, Rajasthan Chapter.
Rajkumar Jaipal, dear.
Rajkumar Jaipal. Sorry.
Could you please hand over the bouquet? Surprising. Now, I did not notice you have come all the way. Guys, we are also joined by Dr. Sunita ji, and there is a long list of brief I can give about her. So, Chief, I wanted to introduce you to Dr. Sunita Garu. Yeah, so Sunita ji, would you mind coming onto the stage and talk a few words? If I'm not troubling you.
Put me on the spot. Thank you. First correction, I'm not a doctor. I'm a filmmaker and a producer. When I had the choice to do what to do, I decided to do storytelling. My dad wanted me to be a doctor, but I couldn't. I'm very scared of blood to start with. I chose stories because stories actually are the imprints of human history. And in my story, I came very close to the medical field because I'm a twice cancer survivor. My first cancer was breast cancer. My second cancer was ovarian cancer. And I got my first cancer when I was 30 years old. And I got my second cancer when I was 46. And I had enough life experiences to be at the deathbed and making it back. And when Dr. Ravitej came and we had a conversation, my journey has been quite divine with many experiences of almost out of body to actually becoming an instrument to the bigger journey. And it's been highly fulfilling. I don't know how many of you know Telugu here. I'm usually known in the Telugu industry. I made about 10 movies, and I'm getting ready to make my first English movie. And hopefully, and I believe the stories I tell are highly inspiring, motivating, and all of you have an individual story which I'm sure is highly motivating and inspiring. And I'm super excited to make this association with Dr. Ravitej. Ours was a very brief 40-minute conversation.
Yes, sure.
Yeah, and then in that 40 minutes, we found such a similarity between both of our lives. And I said that I'm standing by you on whatever you choose to do, and you have my complete support, and I will need whatever is needed for you to succeed in your intent of coming to India. Because just like him, even I came from the US, I'm American. I grew up there, and my parents, my entire family lives there, but I choose to come to India 15 years back because of medical reasons, and I've been here since then. And whatever I could achieve is in India, and my dream is to achieve an Oscar, so hopefully I will do that for India. So
You will
thank
certainly
you.
do. You will
Thank you.
And Sunita ji, I would like to introduce you to my mentor, Professor Dr. Mike. So, Dato, would you?
Thank you so much.
Chief, you want to? So, this afternoon, whatever the corporate social responsibility we are launching towards the children with special needs, the lesser child of the greater God, Sunita ji and Mr. Pawan Kalyan's General Secretary, Bolisetti Satyanarayana Garu, as well as the Mr. A.M. Ratnam, as well as my mentor and our group of doctors will be launching the lesser child of the greater God, which is a organization that would enable the children who has autism, Down syndrome, cerebral palsy to be addressed in the Indian Republic. As our CSR, we have a special quota to treat these children, and we also designed a software platform wherein the parents of all the special children can have an access to the technologies globally so that we can reverse their or give them or promise them a quality lifestyle. So I'm sure that the last 2 lectures you have seen enough results which has been presented to all you people about how the lifestyle of the autistic children or the Down syndrome children has changed for good with the application of the bioregenerative medicine. So, Chief, we could schedule that around post-lunch?
Post-lunch,
Yeah.
post-lunch.
Yeah.
I sincerely say that on my own experience and my own family and the number of children, that I'm saying about thousands and thousands of children we've been treated, for the last 3 over decades, there are solutions for all this. And through our own experience, I'm yet to see a single child who say, I don't have the results from the parents. Everyone will see the result. It's a matter of how intense is the results. But of course, it's not a one-time treatment. It's impossible because the amount of stem cells to be given to the child depends on the age of the child and the weight of the child. Just like when you give a drug, a heavy dose can be given to a bigger person. It's the same situation here. So when you have a child who is 3 years old or 4 years old, you cannot be giving him 16 different types of brain cells. It's impossible. The most he can take, if he's even a bigger sized child, will be 5 cells. So we have to look into that. So we have to decide from the spectrum of the child, we give the right type, and which are the first cells we have to give first. But obviously for autistic children, the first type of cells we have to give will be the frontal lobe, because you need the attention. Once he has the attention, he can focus. Once he focuses, he can pick up. He will learn. Okay, so these are how we assess, and it's the same for all the other disorders. And we are talking about all the special needs children of the world. I used to call the word children of a lesser God, but I think it's not fair to call them of a lesser God. So for that reasons, I change it to lesser children of a greater God. And we must do this in India for all these children. This will be our main CSR to help the children. Of course, the next one will be on the age. What about the sportsmen? As they age, they also have a lot of problems with what they have contributed to the country, you know. So it is my personal dream and ambition, together with my wife of 44 years, to help and save and enrich the life of all these children, because they'll be the leaders of us. Autistic children have special talents, and some of them are called savants. That means they're genius too in their own way. You must do something there, and in the same way, you must do something a lot for those cancer patients. They are solution. There are some non-invasive therapy to do along with, together with the conventional therapy. Thank you so much. Thank you.
Thank you. Now I would request Dr. Rajkumar Jayapal Garu to address the people a few words about the tech or something.
First of all, I welcome Dr. Mike to India and European Wellness, and I appreciate the efforts.
Can't forget me.
That is the efforts Dr. Ravi Teja is doing for this Indian community, and I'm really happy to be here, and definitely I'll associate this cause and this European Wellness with IMA. I'll try it. Thank you. Thank you.
No, books can be later, yeah. Guys, the next lecture would be Dr. Dimitro, the medical director. Yeah. So we will be joined shortly by Dr. D. Okay, I will try to eat your head for 2 minutes then. So, guys, have you ever heard about this line? Inanimate matter tends rather to decay towards a more disordered state rather than to come to equilibrium. So, I would like to tell this is one of the most interesting line that every scientist or the doctor would ever encounter, or even an artist could encounter, because all the universal laws, all the medical science, everything is encrypted in this one line. So for a layman, I would like to detail or explain it. So basically it is saying that you take a human being, for example, Gratia. The whole making of the human being started from a single cell. And if you further go deeper, it starts from the alphabets of biochemistry, which are the 21 fatty acids and amino acids and all. So if you know how to tailor them, stitch them, and then you will be able to master the art of creating life. So later this afternoon, I will give you a detailed lecture about answering the questions of most of the doctors and scientists who would say, how does it work? And does it work? And all those things. The question is never, does it work? Question is all about, how do we make it work? And as a subject matter expert or as a medical professional or a scientist, a simple explanation as to how to make it work is, I will give you a very most common example. If at all the answer to that question lies in one word called the details. If you ask a common man what is 1 hour, he would say it is 60 minutes. And what's a minute? It's 60 seconds. And if you ask what's a second, I would ask this question. Anybody has an answer? Okay. If you ask, that is where the answer stops. It says, but if you ask a person who is powerful enough to see or read between the lines, he can easily say that it's 91926317770 vibrations of a cesium atom. And it is such kind of details which we have to observe even the human biochemical reactions to ensure we figure it out how to make even this technology work. Because the reason why we talk about individualized therapy or personalized therapy is because as physicians and as scientists, we have to dig deep into every case study and figure out how we can make it work. That's why the group of doctors in our group, they will ensure that every case has been studied by subject matter experts from different backgrounds so we can all connect the dots as to how to make it work. It all depends upon, Dr. Dimitro once told me that, Ravi, the greatest learning is unlearning it. And that statement is so true because you cannot go with a generalized concept that, okay, this is how it will work. For you to make it work, you have to unlearn what you have learned and ensure you tailor things to what the problem statement you're addressing. So I would now ask Dr. D to address it.
Wow. Yeah. You couldn't say it better, Ravi. Thank you very much. Ladies and gentlemen, once again, good morning, good afternoon to everyone who is here. My warm greetings to people who have joined us today, who haven't been here yesterday. And, my name is Dr. Dmitro Klokal. I'm associate and employee of Dr. Sri Mike, Dr. Professor Mike. We've been together for almost a decade, right? Trying to push the horizons of regenerative medicine as much as possible. And my today's presentation is going to be a bit more entertaining. It's going to be a storytelling, the actual storytelling with the photographs, with actual dates, with actual living real people. And perhaps, madam, it could be a good idea for your movie. You know, because once we have treated the child of husband and wife. The husband was a producer. He is a producer in Hollywood, and his wife is a Hollywood actress. And when we treated the child, it was about 7 years ago, they said we should make a movie out of it. You know, so ladies and gentlemen, I would like to talk, and the topic of the title of my today's presentation is Minimally Invasive Cellular Transplantation Techniques in Reversal of the Liver and Kidney Failure. I'm going to present to you 2 case reports. Actually, there's going to be more cases presented here, but 2 cases will be with the names. I call them also the 2 Michael case, the cases of 2 Michaels. And before I continue, I need to explain to you why it's relevant, why this topic is relevant, and why am I personally credible to talk about this topic. These photographs were taken on the same day. This is the surgery, and this is me, that's me. This gentleman, it's him, Dr. Lim. This is Dr. Sharif. This photograph was made about 10 years ago. Guess what surgery is this? Correct. It's a liver and kidney transplant. It's a harvesting. Okay, so I'm proud to say that I was a member of the Malaysian National Transplant Surgical Team. Also, I'm the grant winner from the Japanese Society of the Hepatopancreatibiliary Surgeons, and I was paid, invited to Japan to give a talk, and I won that grant for Malaysia, being a non-Malaysian doctor practicing in Malaysia. It was the only case in the history of Malaysian healthcare when a non-Malaysian doctor won a grant, won a prize, while serving Malaysia. And the grant was given for a modification. Me and my colleague, Dr. Sharif, we have come up with idea. We have modified Whipple's procedure. those who know a bit about surgery, you know that Whipple's procedure is perhaps one of the most difficult and complex and complicated surgical procedures ever. We have created a new method of treating and dissecting the pancreatic stump. We reduce the occurrence of the anastomotic leaks, of the pancreatic leak, and reduced by half the occurrence of the pancreatic cysts after the Whipple's procedure. And for that, Japanese Society of Hepatopancreatobiliary Surgeons invited me to be a speaker at their annual conference. And my third accomplishment in reversal of the liver disease is that I was a person who, together with Dr. Sharif, set up a liver surgery department in the state of Sabah, in Hospital Queen Elizabeth. It's a tertiary hospital, from the scratch. We were running it. Then Sharif, my colleague, he became a bit disappointed with the government. He resigned, and for a year I was the head of department. Again, as a foreigner, I was running the liver surgery department in Malaysia. So I'm going to talk about treatment of reversal of liver and kidney failure. And I would like to start with the words and with the introduction again, you know, of this person who is considered to be the father of stem cell, Dr. Arnold Kaplan, late Dr. Arnold Kaplan, who has passed away recently. And he is the lifetime achiever in regenerative medicine for proof that MSCs can modulate immune system, inhibit programmed death, apoptosis, reduce scar formation, to stimulate formation of new blood vessels, and to promote growth of tissue-specific stem cells. And that's a person who has dedicated his entire life to clinical application of the MSCs. And the person who in the end of his life and in the end of his career has said this: the dogma is now absolutely incorrect, and thus calling these cells stem cells was a mistake. So the father of the MSCs, he admitted in the end of his life and career that he was making a mistake, an error his entire life. That cells that he thought would turn into the cells in the body after transplantation and regenerate tissues, it turned out to be not so, absolutely. And he said, it's a quote, MSCs are not stem cells. He said, I erroneously presumed that MSCs would and could provide replacement cells for those cells which are at the site of injury, the site where mature cells have naturally expired. It is clear that MSCs are not multipotent and cannot differentiate inside the body into mesenchymal phenotypes. This is a very important statement for each and every one here to hear, because the MSCs are at the moment are the most frequently used type of the stem cells. And a lot of doctors still are under illusion themselves, thinking that they are transplanting cells to the patients, and they are committing a crime without actually realizing that by lying to their patients every day, all over the world. And then he said that the tissue-specific committed progenitors that are limited in their differentiation capacity, only these cells can form or transform into the cells, like the heart progenitors can form heart myocytes, kidney progenitors can only form cells in the kidney, the blood progenitors, hematopoietic cells, and so on and so forth. A lot of stem cell physicians and intervention cardiologists still claim that if they will inject MSCs into the area of the myocardial infarction, those cells will turn into the cardiac myocytes, and they all refer to the one and only single article publication made about 20 years ago in 2003, if I'm not mistaken, saying that, see, this is a proof. And that article is in vitro. It's an in vitro. In a laboratory, in a petri dish, yes, of course. You can. When I went for the regen medicine study in Utrecht University in Netherlands, we were doing the same. We were growing cartilage tissues. in a petri dish out of the MSCs. But it doesn't mean that if you transplant them to the person, they will turn into the chondrocytes. But the unipotent precursor progenitor fetal stem cells, which we can find only in the late trimester of the fetal development, procure them and convert them into the regen medicine product in the vial, together with the culture and media. Those cells, once transplanted, a large portion of them, at least a notable percentage, can survive and turn into the tissues. The rest will still do a lot of benefits. They will produce the anti-inflammatory effects. They will improve they will sort of prime and stimulate all types of the immune cells, both innate and adaptive immune system. They express a large amount of anti-inflammatory cytokines, okay, that reduce chronic systemic low-grade inflammation, which is one of the main drivers of development of the age-related diseases. Currently, in this century, we are dying because of the chronic diseases of accumulation. We're not dying because the tigers or leopards hunt us, or wolves. We're not dying because of a childbirth like we used to 200 years ago. We're not dying that much of tuberculosis like we used to. We're not dying from different infections because we drink dirty water from the river, because we have water sanitation plants, and also our quality of life is better. We do not die of hunger as much as we used to die. We die because of the overfeeding, because we are feeding ourselves like pigs on demand. Yeah, hungry, just grab something and eat. So essentially we're dying because we're losing our roots. Yeah, we're losing humanity, we're turning back into the animals. And those cells also can produce paracrine factors, growth factors that will stimulate tissues in terms of stimulation of angiogenesis, production of the new blood vessels, which will feed newly regenerated tissue, stimulate endogenous stem cells, reduce the apoptosis, reduce tissue fibrosis, and what progenitor precursor cells do, what MSCs do not do, is this: distal homing and local homing. MSCs 100% become a subject for phagocytosis. Immune cells consume them all. Not a single cell ever survived on this planet, in this reality, in this universe, transplanted into the living organism, MSCs. All of them consumed by immune system, and they work through the expression of paracrine factors. Same is happening to the progenitor cells, but progenitors also can still stay in the body and function. They can create cell-to-cell communication with recipient's own cells. And the slides that I was showing yesterday, the almost 10 years, the 9.5-year survival of the xenogenic pancreatic cells transplanted to patients with diabetes, and 10 years after that they were biopsied and confirmed that those cells are still alive. The dopaminergic cells in that Parkinson patient in the brain surviving after 8 to 9 months, those all are the proofs of the homing effect. So these cells, progenitor cells, they can stay in the body, retain, and give rise to new generations of cells, and thus repair, regenerate tissues. So fetal precursor stem cells, they home to the site of the inflammation, and that inflammation is expressed via the pro-inflammatory markers, the chemokines and cytokines, and those cytokines are nothing else but information. They are messengers. They are calling these cells to come and visit them visit the injured site, the injured tissue. And the cells of specific tissue, they have specific markers, specific receptors, little antennas on the surface of the cellular membrane, and that's how they recognize each other. That's how they recognize their own environment. and that's how they recognize the call, that signal that come here. We are inflamed, we're injured, we're in pain, come and regenerate. They regulate immune responses, they produce new blood vessels, they reduce scarring, they prevent premature cellular death, and eventually repair and regenerate tissues. Kidney and liver regeneration, they're creating a dichotomy here. Liver can regenerate so well that even ancient Greeks knew it very well, and they created a myth about it, of the Prometheus, the person who came like a fallen god, who gave fire to people, and the gods became very angry against him for that. They punish him. He hangs on the rock, and eagle comes every day, I think it's eagle. He eats his liver, and overnight the liver grows back again, it regenerates. That's how great of a regenerative potential liver has, that even not contemporarily educated ancient Greeks managed to figure it out. The situation is totally different with kidneys, and I mentioned that yesterday. Homo sapiens as species are not very lucky in terms of the kidney regeneration. 4 weeks before Homo sapiens sees the light, so on the 36th week of gestation, Homo sapiens complete the development of the kidneys, and the stem cell pool, renal stem cell pool, is completely exhausted. Okay? So 4 weeks, 1 month before human is born, he loses ability or biological capacity or ability to regenerate their own tissues, their own kidneys. And kidneys are very complex organs. I'm going to talk about it, and they're also a site of a continuous injury. So it's not only we cannot repair tissues, our kidneys degenerate from the moment of birth, from the moment when the first portion of urine is created, even in the absolutely normal, healthy conditions. What do we know about ability of the liver to regenerate? Liver can regenerate in biological, physiological, and pathological conditions. There are pathological and biological mechanisms of it. So I took this article and just a few very important, crucial key points that we need to understand before we talk about liver regeneration. So first of all, the stability of the liver function and size also is essential for the body's homeostasis, and there are multiple mechanisms how liver can regenerate. Actually, there's 2 of them. Then there is a notion which is called, so-called, the phenomenon which has a name, hepatostat. Hepatostat means liver in the specific organism, in each and every case, will grow and regenerate exactly to the size of the liver, I mean in literal grams, sufficient for the function. If you take hepatocytes of the smaller organism, smaller species, and transplant them to a larger size species, they will grow into the size of the recipient's liver to correspond to their size. If you take liver cells from the horse and transplant it to the mouse, it will grow as it should grow in the mouse. Transplanted cells, and we know that for more than 100 years, a very good example, it's 1905, it's a discovery of the blood groups, and the whole blood transfusion theory is that it's the microenvironment and the environment of the recipient and the immune system of the recipient that will influence the cells transplanted from the donor, not the other way around. So it's the microenvironment of the recipient that will tell to what size the cells should grow and to what size the cell pool or the entire macro organ should regenerate. And that phenomenon is called hepatostat. It's also very important because we have the understanding and that notion of phenomenon that we use. I'm not sure if you guys know it, but liver surgeons, we have this term as small for size liver, in brackets. Small for size, it's small dash for dash size liver. It means that you have a patient who requires liver transplant, he's got a complete liver failure, and for instance, you do a hemihepatectomy from the recipient, a living donor transplant, you transplant only, for instance, 2 segments. And those 2 segments will not be enough for the patient to survive because liver regeneration in all species is tremendously inhibited once more than 2/3 of the hepatic mass is removed or non-functional. So if you have so-called 90%, hypothetically speaking, gone liver, fibrotic, it's impossible to regenerate it. You have to transplant the whole organ. Okay? Simple as that. Who and how and what is initiating liver regeneration? It's the HGF, hepatocyte growth factor. Hepatocyte growth factor is mostly produced by the progenitors or the precursors of hepatocytes and cholangiocytes, because the liver is so smart that it can regenerate its cells, hepatocytes, not only from the hepatocytes, precursors of the hepatocytes, but also transdifferentiate from the precursors of the cholangiocytes. And this is a very unique scenario when the epithelial cell can completely transdifferentiate into the cell of the parenchymal organ, hepatocyte. This is staining after 24 hours, 1 day, and 7 days. And these brown dots are the cells, the new cells, new naive hepatocytes that are rapidly produced starting from the first day to 7 days after the injection of the cell extracts, the stem cell extracts containing that hepatocyte growth factor into the patient with acute hepatitis. And that's how fast, rapidly they produce, they stimulate, trigger the production of new hepatocytes. Why and when do we transplant livers? I took this data from the European Union Liver Transplant Registry. We transplanted for the hepatitis B, hepatitis C, fatty liver disease, which in 20-25% of cases ends up with a non-alcoholic steatohepatitis, which is an absolute indication for liver transplant. This you still can try and regenerate. This practically not. Inherited metabolic liver disease, toxic and drug-induced hepatitis. And still, we have the donor shortage in spite of cadaveric transplant and the liver transplant options. And up to 22% of the patients die while waiting on the transplant list. Yeah? So at least we can help with this donor shortage. We can help this 22% of the patients at least, and maybe even more. What criteria do we use to understand that? There are no stages 1, 2, 3, 4, 5 of the liver disease, of the chronic liver disease, and all that's for the housewives, okay? There's only 2 criteria. There's a child score, and there's a model of the end-stage liver disease. Every chronic liver pathology is classified or characterized by the child score only. There are 5 parameters. 5 parameters. Each one of them can have value 1, 2, or 3. So the minimal score is 5, the maximal score is 15. The lower the score, the better. 5 means perfect. No ascites, normal bilirubin, normal albumin, normal coagulation status, no encephalopathy. And then as those 5 symptoms start to accelerate, the score is accelerating. We have class A, B, and C, and we can predict roughly 1 year and 2 year survival. That's for gastroenterologists and all surgeons. If you have a patient who is on the liver transplant, you need to know, because you have 100 patients who are on the liver transplant. You cannot give transplant to the guy who is richer. You cannot give the priority to the guy whose father is a prime minister or whose bank account is bigger. That's unfair. The priority is given to the people who have a higher score MELD, model of the end-stage liver disease. It's a formula. It's a formula that takes into consideration, again, kidney function. There's a constant for the liver etiology, liver function, and coagulation status. And with that score, we can predict 3 months mortality. Because how it works, let me tell you, ladies and gentlemen, every month, transplant committee has a meeting. And on that meeting, they will take and go through every case who is on the transplant list, and every meeting to every meeting, every patient has to be rescored. And they will look at the 3 month survival, and then they will give the priority. They will move patients up or down the list. So if you still have chances for recovery, you will never, ever, ever end up on the liver transplant list, because there's 22% of patients who are already on transplant list dying because there's a shortage of organs. So it has to be an undisputed, absolutely reason to be placed on that list. And then estimate is that it shouldn't be death of a terminal disease, so roughly you should have some chances to survive somehow throughout this year while you're waiting for transplant, because well, not even the median, the minimal transplant time waiting, and it depends from country to country, it's much longer in Asia than in Europe, okay, or United States of America, is minimum 200 days, okay? Then we take good candidates. We look at the child score. We look at the model of end-stage liver disease. Unless, of course, the patient has got fulminant hepatic failure and he's got encephalopathy. The brain is not working already. Then perhaps we give the priority to him, even though his score otherwise may be less. So the chances to be transplanted within 2 years in the best golden standard scenarios are only 65%. And the risk of death while waiting for transplant from 17 to 22%. Of course, patients who have viral hepatitis or patients who are transplanted because of cancer have got the worst chances for survival, worst prognosis. Patients without viral hepatitis, without cancer, with a metabolic liver disease, they have higher chances of successful liver transplantation. Now, an alternative to the whole organ transplant is cell transplant. Let's look at the data that we have. There are not many, but there are few publications, and some of them are meta-analysis. And I took this study, particularly this one, because it's one of the best review studies, relatively new, less than 10 years old, 2015, published in the Journal of Xenotransplantation. They talk about 51 report of the in vivo cross-species transplantation of hepatocytes from all over the world. The majority, of course, many coming here from Japan. They transplanted them into various sites, not only into the liver directly, ultrasound guided, they transplanted them randomly in the spleen, in a deep muscular tissue implantation. 47 studies, 92, in 92% there was an evidence of hepatocyte engraftment and function across the species barrier. Hepatocytes of the mouse will do the same function inside horse's liver. Unlimited cell supply. There will never, ever, ever, ever be a shortage of donors as long as FCTI company exists, okay? FCTI is the company which is manufacturing this type of cells. It turns out that even better and easier and safer transplant cells than the whole organ, because we're not transplanting vascular endothelial cells. And those vascular endothelial cells, they have those antigens which cause acute vascular rejection, which is not happening in case of the hepatocyte cell transplantation. Plus, we use the rabbit tissue, which does not have the GAL antigen. So no human body antigen binding, no rejection. You don't need conventional immunosuppressive therapy with tacrolimus, like every patient needs a daily immunosuppression for the rest of their life. You don't need it. And transplanted hepatocyte resistant to human retroviruses. You can't, even if you try, you can't infect them with viral hepatitis B or C because they're just not susceptible to that. Another very good question from a different publication, published in a journal of gastroenterology, and it's a study of Nagata. How many hepatocytes, the question is. We know they were transplanting half of the liver or the whole liver in case of the cadaveric transplant. Okay, we know how much of an organ were transplanted. It's either half or the whole organ, right? If we're transplanting cells, how many cells should we transplant? The Japs have calculated that as well, that how smart they are. From 1.5 billion to 2.5 billion cells is sufficient to transplant via injection or minimally invasive method to have clinical impact. Even that is calculated. This picture is taken from the very first, we didn't even bring that book. That was 20 years old, right? Because we have much better books. But there are in that very first textbook on the xenogenic transplantation, there's a lot of these histological slides and all. You have them all in brochures, you know, you can see this. There's undoubtedly, especially when it's coming to the hepatocytal liver tissue, there's a lot of similarities across the species. Now, where can we transplant it? Where can we implant and graft these cells? Directly into the liver, ultrasound-guided, image-guided, transcutaneous. Liver is an immunoprivileged organ. Well, of course, there are immune cells, the Kupffer cells there and all, but they are absolutely not recognizing these fetal precursor hepatocytes as a foreign body at all. And still it's risky, it's still invasive. You still, especially when you have a cirrhotic patient, the patient with a deranged INR, hypocoagulation and all, definitely there will be septic risks and all. You can do even the intraportal implantation. It's all the alternatives, and then turns out that you can do the subaponeurotic implantation if you want, especially in the patients with the portal hypertension. Ukraine. There was a clinical trial done and there was a PhD dissertation, comparison of the subaponeurotic, intraportal and intrahepatic implantation of the islet cells. They were doing that for the diabetic patients. And they came to conclusion that yes, efficacy is slightly less, but safety is tremendously higher, so you can just compensate with a repeated implantation, either subaponeurotic or the gluteal muscle deep intramuscular implantation, at least as less invasive as possible, and you will reach the same quality outcomes. Do we have data, and what kind of data do we have to prove that those hepatocytes, xenogenic, foreign hepatocytes transplanted, will perform their function and will eventually end up in the targeted organ? And again, thanks to Japanese researchers, and they published it in the Journal of Liver Transplantation. It's one of the early articles. When they took cross-species hepatocyte transplantation and grafted them into the spleen and observe day by day. Day one, they see xenogenic hepatocytes start producing albumin. And they see those cells appearing in liver within the first day. 3 days, By end of the 72nd hour, there are no cells left in the area of the initial implantation. And that's completely corresponds to the data of the Dr. Kment, who have done the radionuclide studies early in 70s in Europe in the animal model, and he showed this specific cell distribution also. And according to his data, within 3 days, we observed complete migration of the transplanted cells into the targeted organs. And that's exactly what Ryuta Nishitai has seen and published in his publication. Do we have other sort of a starting point, other reference points? Who else is doing this transplant, cell transplant? Yes, it has been done both for acute and chronic liver failure, for metabolic disease. They also have figured out, see, the studies from Japan also and from the Western countries, that initial transplantation yields clinical results for not that long, for about a couple of months, 2 to 3 months. But the repeated transplantation within the first 80 days is increasing the clinical outcomes by nearly a year. You know, it's 9 to 10 months, 253 days, that fetal transplanted cells will still stay and function in the body. These cells show exceptional viability and supreme metabolic activity, much better and much higher than patients' own cells, because these are cells with literally 0 years of age. Absolutely young, naive cells, which are procured from the tissue that has been fed properly, that never ever had any hazardous insults of the environment. These organisms which donated these cells are bred in a FDA-recognized facility in the United States of America, specifically to cater to the pharmaceutical industry. So any pharmaceutical company that is using xenogenic tissue, they use it from there. It's the only legit source of these cells. And they very fast help to improve the liver function with even a small volume, a small number of cells, reduce ammonia, reduce toxicity, and even help with the cardiovascular instability. It's multiple few publications. You can know more, you can read more about it if you get this book, Stem Cells, and there's a chapter on the liver failure reversal, and everything is quoted there, all the literature, everything is given there. It's one of the old outcomes, 2 weeks, patient before and after, 2 weeks after precursor cell transplantation. GDT reduced almost by 100, but normal transaminases, alkaline phosph, also reduced, and from triple digit to double digit. So now we're coming to the patient by the name TM. His name is actually Michael. I'm going to show you his picture. He gave a testimony. I met him at the age of 50. He was a construction company owner. He's not a construction company worker. He owns a construction company. And because of his nature of work, and he was at the construction sites, he was dealing with raw materials and the purchase of it, you know, and then running the whole operation. So basically, he developed a toxic hepatitis because of the phenols and different toxic materials that he was in touch professionally in his line of work. And he has presented with a jaundice. Bilirubin was 55, no, 4.5 different numbers because this is from American continent. High LST, ALT, deranged coagulation. Already sodium climbing down, albumin 21. Still had minimal ascites, minimal encephalopathy because he was young and otherwise quite a more or less healthy person, so he was a bit more compensated. Lucky for us, he did not develop hepatorenal syndrome yet. He had a normal kidney function, he had a normal creatinine, he had tremendously deranged gamma-glutamyl transferase, He had loss of appetite, fatigue, generalized weakness, and what actually hit him, what usually does not happen that often in a liver failure patients, he became tremendously anemic. 6.5 hemoglobin, hematocrit 18, RBCs 2, and he was very inflamed. His total white count was very high until 15 with a shift. He was scanned, he was biopsied, there was no malignancy in the liver, there's a findings consistent with a toxic hepatitis, unequivocal diagnosis, and he was put on the liver transplant list. He was put on a liver transplant list with a MELD score over 20, range from 21, 23, 25. So we're talking about 20%, 3 months mortality. His child score was around 8, 9. So he had about 50-50 chances that he will live for 2 years, and he could live for 1 year with the chances of approximately 3/4. This case was co-managed together with a very senior and very experienced doctor in California who has spent a lot of time in Europe, and she knows Professor Mike for like, I guess, 20 years, right? Maybe more. And I also know her, but I'm not very good with memorizing people's faces and names. And she said, hey, doc, we met like, 7, 8 years ago in Baden-Baden Medical Week in Germany. And I'm like, okay, fine, So she was absolutely in line, synchronized with what we're doing, she understood. She took over she actually referred her patient to us, for specifically for the final stage for the stem cell transplantation, because the actual hepatoprotection was done by her. She addressed to the oxidative stress, she did all the detox, gut detox, she helped to reduce the initial stages of hepatopathy, encephalopathy. She provided otherwise a very good holistic treatment for the patient. Then she passed him over to us. Well, he was already on the transplant list. So, the toxins are eliminated, the business no more. Sold business, not dealing with construction materials. Forget about it. Focus on health. It's tremendously nice, pleasant guy. The patient himself with absolutely incredible wife. By the way, in both of these cases, both men survived because of their very notorious wives. Okay, wives who fought for their husbands, for their health. Fantastic. So detox, UDCA, you need to promote the outflow, detox the liver, ursodeoxycholic acid, bile acid binding, chelation, all dietary modifications, gut detox, this is so important for liver patients. Otherwise it's a constant toxicity, they keep on poisoning themselves. Hepatoprotection, plaques therapy. If you break down liver into the chemistry textbook, by 80% it's phospholipids. It's the phosphatidylcholine, phosphatidylserine and all. So plaques therapy delivering essential phospholipids. NAC in adequate doses, SAMIs, L-carnitine IVs, everything was ongoing regularly. Hyperbaric oxygenation regularly. Detox, plasma exchange, prerenata, whenever patient is becoming more toxic, it's all done. Massive antioxidant protection with the gluta. We put them on the mitochondrial peptides, cell extracts from the liver. Already they do contain hepatocyte growth factors, so we have started preparing the terrain for the stem cells, Sort of, it's like a tsunami. Has anyone seen tsunami? How it comes, really? No? Do you know that before tsunami comes, the water will pull back, right? And then the first wave will come. And that first wave of tsunami is just a few millimeters thick. It's a thin layer of water that will go, because water slides on the water, and the next, that wave will come on that thin wave and will crash everything. So we've done the same. We put them on the liver cell extracts with the placental growth factors in liver to prepare patient for that. Run that for at least a couple of months. And then there were 2 transplantations, July and mid-October, a booster dose. As it was on the previous slides, yeah, just do the booster dose, do the re-transplant within 2 to 3 months, and that was all done last year. What was the precursor stem cell protocol? Stem cells were from the FCTI company, double volume, and not only a large amount of vials, 2 or 3 vials of the same type of the cells, but also per vial, the amount of the tissue was that were requested the lab to prepare was higher. So at least we're talking about, 500 billion cells per 1 milliliter. Now you times 2, you have 1 billion cells. Now you times 3 by the amount of the vial. So we're talking about 2 to 3, maybe more billions of hepatocytes transplanted to this patient. Placental cells, again, huge amount in billions. Mesenchymal hematopoietic cells. You remember the patient was tremendously anemic. No blood transfusion. I'm going to show you what happened to the patient, the blood work after this. Thymic therapy, and then we took care of the support patient's neural health, central nervous system, because still, even though perhaps clinically not that pronounced, but it is impossible that patient with a liver failure does not have encephalopathy. It is impossible that patient with a liver failure does not have kidneys involved in that. So these precursors were also added on for the holistic treatment of the patient. Let's look at the timeline. Before treatment, July, mid last year. Child score 9, MLD 25, high bilirubin, low hemoglobin, low hematocrit, anemia, inflamed patient, lost liver function. Sodium 127. You know, these patients, they happily die in your acute ward with hyponatremia when you start correcting this low sodium, you know, that's how they die, you know. Has anyone seen this patient going away? No? I've seen a lot. Seen a lot, you know, patients with a liver failure in my ward. Transplantation done. Second booster dose in October, done. Now it's time to see the results, evaluate the results. Child score from 9 to 6-7. Model of end-stage liver disease from 25 to 15. Bilirubin from 54 to 41. Hemoglobin from 6.5, 11.7. Hematocrit 35. Total white normal. Albumin 40. Albumin globulin ratio 0.8. INR 1.4. GGT 100. Double-digit transaminases normal sodium. We have successfully reversed liver failure in the patient who was on the liver transplant list without liver transplant, just by transplanting cells. Later on, 2 months ago, March 2024, let's see whether it still worked, right? Because the patient is no more on the transplant list. The patient is walking free, you know. He's all right. He's got a normal child score. He's got a normal MLD score. He's got a tinge of jaundice. He doesn't have anemia. He's not inflamed. He's got even better liver function. He's got normal INR. And he's just fine. That's him. And that's his beautiful wife. And that's him removed from the transplant list. He's asymptomatic. He's well. He eats what he wants. He's got a normal, regular lifestyle. He does whatever he wants. He's got a child score of a 18-year-old football player or cricket player. He's got a MLD score of some marathon runner. No active management from gastroenterologists. He said farewell to the liver surgeons. To the guys who transplant organs, he said, bye-bye, not gonna see you ever in my life. He's just got a half-year follow-up with gastroenterologists. He's still taking the plaques therapy. He's taking mite organelles, mitochondrial liver extracts from liver, and essential essential micronutrients. Can you please press and play this? It's a short video. No, please go back. This one is a short video. You need to press on this picture and there will be a bar. Play this video. This is video. Does he know how to do it? Can somebody help him? This file, it's not a photograph, it's a video. If you put the mouse indicator on this video, there will be a increase volume and start from the beginning. Can you hear that? Start from the beginning. I'll put the microphone here. No, we have to play this video now. Please play the video. It's very easy. I can come and do it for you right now. You don't have to have a degree in computer science to do that. Play the video. Put back the slide. Remove your hand. And speaking about success, I agree. And speaking about success, I agree. This week we have received the latest blood work. 6 years ago, the GFR, glomerular filtration rate, was 9. At the time, Michael was on a regular hemodialysis with an end-stage renal failure. Then, throughout the course of the treatment, managed to push it slowly to 11, to 19. Then GFR became 21. Then, subsequently, when the hemodialysis became only when necessary, and then he was off the hemodialysis. The numbers of the GFR that I remember were a couple of years ago were 29 to 31, and this week we have the result of GFR 45, which generally brings about 80% of the kidney function reversal, and it's pretty remarkable. Now let me tell you how it happened. First of all, before you do something that is not to say impossible to do, but was practically not done before by anyone else, you need to check whether it's feasible. There has to be a feasibility, right? Is it possible to do it? Is it achievable? You know, so if we look at the retrospective data, these two articles are published by us. This is an earlier article. This is a bit more recent. And these articles are dedicated to the previous retrospective experience of the reversal, or rather say downsstaging of the CKD. I'm going to briefly explain to you what the articles were about. First of all, they were talking about the extreme renal complexity, because kidney, unlike liver, morphologically, its microstructure, it's much more complicated organ by its organization. And the embryology, the embryological journey of the kidney is perhaps one of the most fascinating stories that you can read in a textbook of embryology and histology and human histology, okay? MSCs. That's how our organism, God, nature has created us, that we can recover from one single insult. Repeated insult is causing this: escalating fibrosis, loss of cells, nephron dysfunction, atrophy, and it all turns into the vicious cycle that clinically is known as the progression of the chronic kidney disease, which is absolutely irreversible condition. If you come to nephrologist diagnose you with a CKD, say stage 3A, he will tell you, you know what? Go back home, come back in 6 months' time, we're gonna check your GFR, and we're gonna do that until you will reach stage 5 and stage renal failure. Then I will put you on the hemodialysis, and then I will refer you to the vascular surgeon. He will do the AVF fistula for you, and then we're gonna refer you to the kidney transplant specialist, and that guy will put you on the transplant list. That's the scenario. Exactly. Irreversible. Look here. It's no treatment. Exercise, healthy eating, don't smoke, don't drink. Live healthy. Do yoga in the morning. Brush your teeth, be a good boy, go to school, and make sure that you iron your shirt, you know, and then you wipe your shoes. And wait for the CKD to reach end-stage renal failure. We're gonna put you on hemodialysis. If you take all the money in the world that mankind, our civilization, 9 billion people, spends on healthcare, including insurances, hospital bills, medications that are bought in the pharmacy, all supplements that are ordered online from iHerbs or bought from Himalaya. Do you know this brand, Himalaya? Guys, yeah? In Malaysia, we know this brand, Himalaya. They say from India. True or not? Or they were lying to us? True, right? Okay. Well, at least I can. I know it's not a fake, right? They say from India, Himalaya. That's why we buy la. So if you take all of that money in the world and call it annual global healthcare budget, money that we spend, 9 billion people, on managing of this is 4%. There is no other condition in the world, there is no disease in the world that drains that much of a money that CKD. 4% of the entire global annual expenses on the healthcare. It's tremendous money. I mean, it's counted in what, some trillions, you know? And there's no solution for that. Now, what do we know? The story becomes even more complicated here. It's not only that MSCs or any other type of the stem cells, impossible for them to work. It turns out that kidney is so complicated that they have renal precursors type 1 and type 2, because the precursors for the glomerulopodocytes are different from the tubular epithelial cell precursor cells. It's that complicated. And of course, together they will produce either, together they will produce the regeneration of the epithelial cells, tubular, and the neovascularization and the restructuring, remodeling of the Bowman capsule. Plus the pericrine effect, because these cells will also express growth factors, various cytokines that will provide reprogramming regeneration, further will stimulate tissue remodeling in the kidney, thus providing the repair. That's how the cells look like, the courtesy of the Barton lab and the FCTI that is producing these cells. It's just with a different staining. In that cohort, we took the sort of the middle range, you know, the 3A, 3B, and stage 4, 16, 12, 11 patients. You know that in case of the CKD, the GFR calculation and the staging for men and women is slightly different, so it's gender specific. So I broke it down further on the 2 subgroups. They were all in age from 45 to the 7th decade of life. And it was a multicentric heterogeneous cohort. There were some diabetic nephropathy patients and also patients with different nephropathy etiology. Treated with our approach, and let's see what happens within 1.5 years after treatment. So this cohort, it's the 3A males, 3A females, 3B males, 3B females, CKD4 males, CKD4 females. The blue one is before treatment, GFR levels before treatment, red GFR after 6 months, green GFR after 12 months, GFR after 1.5 years. In all groups, we observed downstaging of the CKD. And now we're coming to this pleasant person whom we met 5, almost 6 years ago. He was 68 years old at the time. What actually happened? In the beginning of 2018, he had a myocardial infarction. This is a classical case of the things went tremendously wrong. Just a normal MI that the doctor here perhaps dealing with. Doctor, if you don't mind me asking, how many myocardial infarctions do you treat per day? Maybe 4. Yeah, so usually you do the angioplasty, you put the stent, right? And within less than a week, patient should be home, right? Yeah, if things go well, right? Well, they first perforated the artery, he had the hemopericardium, then they perforated the myocardium. He had 2 open heart surgeries. The second open heart surgery ended up with the mitral valve replacement. He's got a porcine valve. And he woke up with a complete bilateral renal artery thrombosis with end-stage renal failure and regular hemodialysis after surgery. It happened on him during the operation and the ICU management. He spent a couple of months inpatient. He came out completely ill, cardiomyopathic with a replaced valve. Not functional. He could not come from the hotel room, come down to the conference hall. His wife, she was a biological doctor. They had a practice in San Francisco. He's a clinical psychologist. So she found us. She brought him from San Francisco to San Diego when we were at the conference, at the medical conference. She brought her husband. She came to the conference hall and she said the husband feels so weak he cannot even come down from the room, you know. And they were very short of time because Monday, Wednesday, and Friday, religiously, he was going for hemodialysis. We met him almost a year after this all happened. She did not do nothing for that year. She took him for a stem cells. He has done MSCs, MIV, few times in United States and California with a facility, with a person who is one of the oldest, the most world-renowned stem cell practitioners from 70s. I'm not gonna name his name, and the result was 0. 0. Tons of money spent, absolutely no improvement in terms of the heart function and kidney function. Then she comes to us. June, July, she did MSCs, no effect. Conventional management, no effect. End of October, some early November, GFR 9, ejection fraction 27. I mean, you still can live with the 27, right, doc? Still okay. Or you want a better? What's the ejection fraction that you want your patients to have? 45. I take your word, you remember that, yeah? He said 45. Interventional cardiology says at least 45. Let's see. Let's see. We started treatment. I told them, guys, you know, like this, we're not gonna do heavy artillery. We're gonna start slow and we're gonna test. If we see a slightest improvement, slightest indication that it's working, we are going to escalate therapy. We have laid up a very smart plan. You know, it was a very well-calculated plan. And that person was wife. Yeah, wife was very helpful because she has done everything. Now, the first thing that was done, and that was done in University Hospital, was, again, we need to figure out, is it feasible are we going to do? Are we going to even try, attempt, or no? How can we answer the question? Are there any possibilities of the reversal of his condition? And what we have done is called the single-shot cardiorenal scintigraphy, SPECT MRPI, single proton emission computed tomography, myocardial renal perfusion imaging using this tetraphosphine. If you take this publication and read it, it's one of the methods, one of the golden standard methods to assess the cardiorenal function in patients who have survived myocardial infarction. That's how it should be, and that's basically what we've seen. But what we have seen is that the patient had, you see, he had a vast myocardial infarction. The amount of cardiac myocytes, the maximum limit of the cardiomyocytes that die during the acute MI, and the patient still survives, is about 1 billion to 1.5 billion cells. I didn't come up with these numbers myself. I took works of the Olaf Bergman, if you know who is Olaf Bergman, doctor. No? Okay, for many years, even when I and Dr. Olha and you went to medical school, we were taught that heart is a postmitotic organ, right? That it cannot produce new naive cardiomyocytes. Olaf Bergman, I encourage you to read his studies. He has done the C14 radionuclide studies, isotope studies, and he has proven that there's a cardiac myocytes annual turnover that is reducing through life. After 40s, it's only 0.45%, but still, he has managed to prove with the C14 radionuclide studies that heart is not a postmitotic organ. Same goes to brain. When I went to medical school in the 90s, I was taught that brain is a postmitotic organ. Now we know that hippocampus is producing, even at the age of 90, up to 800 new neurons. All that you have to do is just stop eating sugar, because the only substance that terminates neurogenesis and neuroplasticity, production of new stem cells in the hippocampus, is sugar. That's it. It's sugar. So we have done that. And in the center of the myocardial infarction, they've seen traces of the perfusion tracer. And they've observed slightly dots, you know, the presence of this tracer in bilaterally in kidneys. So, wow, something is getting there, let's try. So, first 2 months, 3 months of mitral organelles, kidney, heart, 3 per week, intramuscular. Then I put him on a peptide therapy. I'm not going to tell you the protocols of the peptide therapy because I reserve that only for the master class, okay? If you become my master class student, I'll teach you what secretagogues, which peptides that stimulate revascularization of the thrombus, you know, so I'm not going to tell you it now. Put him on the high-dose NIC, L-arginine, L-carnitine, anticoagulants, thrombolytic therapy, placental growth factors, regular hyperbaric oxygenation, regular ECP, and he was still on regular hemodialysis. With that protocol, he was still producing more than 500 mils of urine, and within 3 months, his GFR moved from 11 to 19. When I saw this, I said, all right, we're going to escalate the therapy, bring him back to our facility for a couple of weeks, and we're going to do stem cells. There were 2 stem cell implantation within 2 weeks. First, with a high dose of the precursor stem cells. The booster dose was given with the frozen cells. We gave him about 3 billion plus renal precursor cells, couple of billion of cardiac myocytes, mesenchymal cells, hepatocytes, vascular endothelial precursors, neural cells, thymic cells. After 10 days, we gave 6 vials of the heart precursor, placental cells, and kidney cells. He was still on the regular mitopeptides from kidney and heart, NAC, LA, L-carnitine, placental growth factors, IV ozone, IV laser therapy, hyperbaric oxygenation. And then his nephrology started reducing from 3 times per week, first twice a week, then he put him on the PRN, Prerenata, hemodialysis, and then GFR after this, within a couple of weeks, reached 21 after the second stem cell transplantation, And the nephrologist said, you don't need hemodialysis anymore. So we have done laser also because it tremendously stimulates cytochromes, the mitochondrial complexes 1, 3, and 4. It also acts as a NO nitric oxide release promoter, so it's vasodilator, increase the blood supply, the circulation in the area, stimulate cells. We talked about it yesterday. Hyperbaric oxygenation, same. It's a data from Howard last year. They stimulate just one single session, produce nitric oxide, produce interleukin-10, which is a massive anti-inflammatory interleukin. It reduces tumor necrosis factor, interleukin-1 and 7, and it stimulates production of the progenitor cells. All of that was done all together. By April, 5 months after we started the treatment, 3 months after the stem cells, patient is independent of his daily life activities. He's got a bit still shortness of breath. He's got a bit of fluid retention, still there. He can produce about a liter of urine. His GFR became 29, 31. He maintained it for a couple of years, and his ejection fraction was 45. And we still kept him on all the treatment. On all the treatment. Because I told him he's going to come back. 21, 22. Early, the whole 2020, the whole 2021, he was absolutely fine. During pandemic, he was totally fine. One thing that he has done, or rather has not done, he did not do COVID vaccine. I think that also partially saved his life. Yeah, he did not do the COVID vaccine. Then his wife passed away. Horrible, unfortunate event. She died because of the aortic aneurysm rupture during breakfast. She died right on his eyes, sitting opposite table, you know, with him. He called me the same day, and he just, unfortunately, and he went down the road. The worsening of the cardiac symptoms, uncontrolled hypertension, massive fluid overload, ejection fraction went down the drain, shortness of breath. He was not well. He said, I feel that I'm dying. I said, all right, you're going to come to me in Kuala Lumpur. And he flew. He's 70 years old already. He was 68 before he's 70. And we have started the whole 9 yards again. You can see, look at this. The amount of the precursor stem cells that went into him was incredible. I put on some stuff, I call it an Olympic protocol. Like I deal with athletes, you know, it's my hobby, it's my passion. You know, I'm a martial arts expert. I have a 3rd dan black belt in karate. I was fighting. I have a gold medal in heavyweight kumite 10 years ago. It was a long time ago. Yeah, it's last time fought 10 years ago. But I'm also a competing amateur bodybuilder, believe it or not. Okay, and I deal a lot. I enhance patients, my athletes. I enhance them, including doping and all weights allowed. Yeah, in the sports, in the competition where doping is allowed. So I consider myself a doping expert as well. Once I enhanced without banned substances, Malaysian cross fitness team. They won Southeast Asia. They brought the silver or bronze, something like that. You know, and their top athlete was breaking his personal records twice in a week. And his coach was telling me the guy started complaining on insomnia. I said, yeah, because his recovery time became so short. You know, the guy is like pumped all the time. Twice a week he's breaking personal record in weightlifting. Can you imagine that, the power of regenerative medicine? I put him on meldonium, cocarboxylase, CLA, L-carnitine, NAC, ACE2 inhibitors, CoQ10, IVs, hyperbaric oxygenation, daily ECP, IV laser, placental growth factors, mitochondrial peptides. It was a massive, super massive management for a couple of weeks. Patient goes back, he's totally fine. He was so fine that he did not even call for a year. You know, he was still reporting that until the end of the year, saying like, I'm fine, I'm fine, I'm fine, I'm fine. Next year, don't hear from him almost anything. He's great. I just sometimes see the pictures. He's either here, go for a walk, go for jungle trekking. You know, he bought property in Ecuador, you know, and developing his business, you know, and it's like the nice photos when you see that the patients in the age of 71, you know, after myocardial infarction, valve replacement, 2 open heart surgeries, end-stage renal failure, and always going for some jungle trekking and hiking, you know, I'm super fine, okay? He has settled his personal life. He's got a partner, a new partner. So a new youth, right? With a youth restoration, a new partner, a new life in the 8th decade of life. Then came early 2024. Then he started calling. Suddenly in February, he says, shortness of breath again. I'm feeling worse. And he said it's like rapidly getting worse and worse. It was so bad, the pleural effusion was so bad, they had to do pleural tapping for him. His creatinine was still, surprisingly, not so bad. Troponin, 600 plus. How do you call that, natriuretic peptide? Doc, is that normal figure? 6,700? No? I think like 100 is okay, right? But this is what, about 700 times above the normal range, right? Cardiomyopathy, isn't it? Yeah, I thought so. Yeah, true. Plus the LBB block, AF with atrial flutter, and bigeminy. That's what I got. March, right? He came in March this year, again, to me in Kuala Lumpur. That's what I got. I called Dr. Olga, tell her all about it. Show the ECG, echo, she said everything. And she said, you know what, send this patient to the cardiac CCU ward, please. Don't manage him. Send him to the cardiac CCU. True or not, Olga? I said, no, I'm gonna try. I'm gonna try. So we try. That's combined protocol of combined management just 1 month ago. 18 vials of stem cells, billions and billions of cells split out into 2 transplantations. Again, meldonium cocarboxylase, CLA, L-carnitine, HBOT, ECP, clexane for 5 days, 0.4, changed to apixaban 2.5 BD, eplerenone 2.5. We brought down, because his cardiologist put him on Lasix 40, we brought it down to 10, put him on this dapagliflozin, 10 mg, all the carvedilol, Vastarel. I even took it myself, you know, really helped me. Really helped me. I love this drug. I love this drug. A couple of months ago, you know, 2 years ago, there was Olympic Games, Summer Olympic Games, and there was the 17-year-old. We all know, if you watch the Icarus movie on the Netflix, yeah? 100, it's a national program in Russia. They dope all their athletes, each and every one of them. It's the order of their insane ruler to dope all their patients, all the athletes. She was 17-year-old gymnast. She was doped with Vastarel, and because of that, World Anti-Doping Agency has ripped off her gold medal. It just happened a couple of months ago. It took them 2 years to prove it, because they used other substances, including diuretics and all, to mask and cover up the use of this medication. Vastarel is intrinsically changing the metabolism of the cardiac myocytes. It make it uptake glucose, sugar much better, you know, so it's more efficient. Am I right, doctor? MO kidney, Might Organelles Heart, Swiss Natural IRS, and Kidney Health. This has liposomal, those natural occurring molecules that reduce systemic inflammation. PQ10, it's a combination of placental growth factors with the coenzyme Q10. I told him you continue this for lifelong, and Dr. Olha prescribed him with a transesophageal echo, which is supposed to be done, I don't know, we'll wait for a week for his results. That's him. A couple of months ago, it's my nurse, it's my resident doctor, that's his new partner, that's Michael himself, eating ice cream before they went back home. First they flew to Europe, he spent a few weeks with his daughter, grandkids, then they went to United States, then went for Ecuador, and I'm texting him, any shortness of breath, anything? No, none. He's producing more than a liter of urine, GFR 45. By the end of the last treatment in KL, GFR was 45. 45. And that's the timeline. Started 1st November 2018, GFR 9, ejection fraction 27, regular hemodialysis. GFR 45, ejection fraction, I think, also should be over 40. You can go on this YouTube channel and watch all the videos of him, all the testimonials. You can go to the European Wellness.eu and on a website also watch his past testimonials and his wife, where she described day by day the whole story with him, and on our social media. And thank you very much. Please remember that neither you nor your patients don't have to die young or get old and deteriorate as you age, as long as you are with European Wellness. Thank you very much for your attention, ladies and gentlemen.
Thank you, Dr. D, for your insights. Everybody can head for lunch, and please, I request everyone to have an early lunch. We have a meeting at 3 o'clock here with Sailesh Hiramani, so please be back on time by 2:30 or 3. Thank you.
While saying so, as physicians and as scientists, we are the engineers of the biological system. And if we are asking that question per se, then I don't really feel it sensible enough. And I will try to start this lecture and make it more and more interesting and deliciously complicated so that you will understand and you love and you will enjoy this this lecture of mine. So guys, you all would have heard about one of the line, inanimate matter tends rather to decay towards a more disordered state rather than to come to equilibrium. While saying so, it took 7 days for me to understand this line. It took 7 days for me to understand this line during the initial days of my career. But later on, I understood that for Darwin, it took 100 years to ensure that he encapsulated his entire research in this one single line. So for a common man to understand, I would keep it very simpler. So they're basically saying it takes small atoms to be constructed to a megastructure like a human being or any animal. And having been constructed, the same megastructures will eventually go towards the atoms. But there is never a stable or a steady state of equilibrium is never attained. So, take a human being, or the entire life as we say. So, with the bioregenerative medicine, we are actually trying to create life or create organs, create structures. Now, it is very important as scientists and physicians, what are the principles underlined? And of the most important reason, is it working? Can you? Yeah. So that is one of my laboratories which I worked back in New Zealand. And yeah, that's more of my home for many years. So, yeah. Asking ourselves, when we are planning to create structures or create organs addressing the degenerating organs, the very first things as medical fraternity which we need to understand is what are the principles underlined in it. So, guys, be it a human being or a dinosaur or a dog or anything, we all have the same molecules and the same alphabets of biochemistry, which are about 21 molecules. And now, there are only 3 points we have to understand when we wanted to understand bioregenerative medicine or how to make this technology work in any diseases. And we are talking about proteins, peptides, and enzymes and everything. So there are 3 fundamental foundations of biochemistry. One is the structure and catalysis. And the second one is bioenergetics and metabolism. The third is the information pathways. All these 3 things put together is life. Is life, simply. But first of all, for you people to understand without going deeper into the scientific things, I would rather give you some of the examples of the things we have addressed in my career, as well as, and then we will build the film backwards. So this is one of the subjects in Aurora biosurgery during my time as a scientist in Aurora biosurgery, where these are cases from chronic diabetic ulcers and gangrenes. So this company which I've earlier worked, what we used to do is, we used to take the cells from the intestines of the sheep, which has powerful regenerating capacities. And we used to design a medical patch, a device, and implant in it, wherein the entire foot reconstruction, you would have seen this from initial presentation to the finally how it has been healed. If you look at the very last image, it's a totally reconstructed foot from that is where the first imprint of my encounter with bioregenerative medicine started. Because all the while I've been addressing every problem statement individually, discovering the genetic switch of Parkinson's and everything. And then how many years are we going to spend in each and every problem statement after all? So this is one of the extracellular or the tissues which are outside the body, which has been healed. And now we are also designing the same patch interstitially to address the chronic ulcers in the stomach. So, and these are one of the kidney disease problem statements which we have addressed using the same bioregenerative medicine. So, all these studies, it eventually say only one thing, that, and the native cells when you extract from the human body, and if you observe them carefully, they have the capacity to produce the renal tubular cells, epithelial cells. So basically, body has the capacity to regenerate. Now, how do we as physicians and scientists and doctors understand what are the factors involved in addressing, tapping that power of the body and ensure that the regeneration can be triggered by the body in itself? And that is where bioregenerative medicine and our efforts towards understanding the technology comes into play. After all, we are not the end audience or the procurers of the technology, or we are not the patients. We are, at the end of the day, we are the brains behind treating a patient. So now that you have seen some of the results of what we have already done, this is not something future, this is present, this has already happened. And there are only two companies in the world who could do this on the back of their hand. One is ProKidney in US, and the other one is FCTI in Germany. And at least ProKidney is only limited to kidney disease. But when it comes to FCTI, they are the masters of the trade in designing the organ-specific cells and progenitor precursor cells, which is the key to address almost every problem statement. So whether, now I have already answered your question whether or not it is possible. Yes, it is possible because you have the results right there. And these results are published in American journals, and US FDA itself has funded these companies with $200 million to ensure that yes, this technology has to be coming into the country. But is India, as we and our doctoral and scientific fraternity can be 2 to 3 chess moves ahead in becoming the subject matter experts in this technology? Can they unravel and decode this technology and understand how to tap that regenerating capacity of the body? So this is the question. And now what are the answers? Now I have shown you the external results. Now let us go into the molecular level. That is where it is important we understand how these biomolecules function. How do we understand their enzymatic processes, and how do we tap the same processes in order to create these structures? That's what will come into place. So in order to do this, we have to understand one is the structure and the catalysis of any megastructure, be it kidney, be it pancreas, be it liver, be it brain. How does that work? What are their amino acid chains? what are they made of, and what are those enzymes which are intermediating the proliferation or the maturation of one particular cell line. That is more important. It's not like, yes, you got the cells and you just implant it and then it will do its job. No, you have to engineer it. When you're constructing a building, you will not settle with buying the cement and the bricks and think that a building will be born by itself. You will engineer that building. So now the question is, how are we engineering this entire process of regenerating the organ? And that is where our products like mitochondrial organelles, nano-organopeptides, FOPs, everything will come into play, because it will address three major things. One, the structure of the organ. Number two, the energetics and the metabolism and the processes involved in that organ. And number three, the information pathways. Yesterday, there was one of the scientists who is present in this audience. He asked me, sir, have you done any research on the genetic pathways? Yes, we understand that there are cellular mechanisms which you have mastered, or wherein you have the subject matter expertise. But have you done anything at the genetic level? So, in order to answer that question, our human DNA, the very molecular bondings which has been designed, it is designed in a way that it can be amended, because they have been the interconnecting bonds are very weak ionic bonds. So if at all we are giving a cell, stem cells, which has the potential to code the specific protein or the peptide units, eventually it's a two-way communication between the DNA as well as the organs. Because how it happens is, during birth, the entire genetic information of a human body and the organs it has to code for has been coded in the DNA. And as we are growing, several factors, environmental, lifestyle disorders, which will eventually affect the DNA, which is the reason why the organs will lose their functionalities. But however, surprisingly, God has understood that humans are good at messing up themselves. That's why He has got this very weak ionic bonds which can be amended. And that can be done by understanding the bioenergetics and the metabolic processes of this molecular biochemical reactions that will intermediate in making the organs and in the breaking the organs. And number three, information pathways. If we can ensure that we can address this while designing our treatment protocols, by understanding our patients very clearly. And again, I'm sure that you're all aware that though we are all human beings, every human being's body is different. The way the mechanisms work is different. The way their allergies are different. So that is why we insist on something called the individualized therapy or personalized case studies. That is why 7 to 8 doctors of our group study on one particular problem statement and ensure that they come up with a protocol very well tailored to that particular patient. And whenever we are doing that, we will ensure that we make it a point that we address all these three factors of structure, bioenergetics, and the information pathways, so that the process of making the organ works. We will make it work. It works by itself. So the true intellectual property, like Dr. Dimitro once said, is not the technology in itself. It is the doctors. Doctors who can engineer it on the back of their hand. So now I will not bore you with too much of the scientific things, but I will make it a point to let you know what are the main factors as scientists and physicians we have to take into account while making the bioregenerative medicine work. One is the cellular foundations. We have to understand what are the biomolecular processes involved in the cellular, at the cellular level, and the chemical level, and the physical foundations, and the genetic foundations, and the evolutionary foundation. So we will have to, guys, one more thing. While this lecture is going to tell you about the molecular aspects, I am sure that there are the patients here in this audience. Whenever we are treating the protocol, I do believe that addressing the mental health is the first and foremost thing as doctors and physicians we have to do before we even go ahead and start engineering something to address their organ dysfunction or degeneration. So, and the best way to address the mental health is to give them the confidence, yes, it is possible. And the only way one understands that whether or not it is possible is by understanding the details. And when I'm saying about the details, it is not second. If you say, like I was telling before, if somebody asks what's say 1 minute, they will say 60 seconds. If you ask what's the second, they would not have an answer because they would not have the detail. And but since we are the subject matter experts, we should know that detail. To define that 1 second is 91926317770 vibrations of a cesium atom. And unless we know the details, we will not be able to solve these problem statements. Because if you know about how a biological nose, the olfactory receptors work, the very first common household gas cylinder, it does not have any smell to it. And there are a lot of series of explosions. Now that you cannot make every housewife a scientist or a doctor to know how to see a gas when it is leaking. That is when the details come into picture of a scientist where he understands that there is a chemical molecule called methyl mercaptan, which an olfactory receptor in the nose is sensitive even to 1 billionth percentage. Even if it is present in the 1 billionth proportion in the air, the olfactory receptors will be able to detect it. That is when that scientist has ensured that he mixed that detail of a molecule into the gas cylinders, making the life of housewives, leaving the housewives to, giving them peace so that they can complain about and torture others. I'm so sorry, I'm kidding. So those details are important as subject matter experts. Because when we are talking about enzymes or peptides, we are also, we are basically talking that these peptides and amino acids which we are referring to, they are coming into place in addressing the bioenergetics and the metabolism. Sometimes we do ask our patients, have the cells implanted in your body and go for the peptide protocol. By implanting the cells, we are basically addressing the structure of the organ. We are giving the cells which have the potential capacity to divide and become a functional organ. But when we are talking about the biopeptides, we are basically talking about addressing the second layer, bioenergetics and metabolism, and catalysis of ensuring that molecule becomes a structure. And as it is becoming a structure, we are also simultaneously addressing the information pathways, because the structure in itself will code the DNA back to its state of normancy. So basically the genetic code will create the organs. And as the environmental factors create an impact, the genetic information or the DNA will lose its integrity, which is why organs become dysfunctional. And it comes to a state of point where there is a point of no return. And when you are implanting the cells, which has functional capacity, and you're addressing the bioenergetics and metabolism, since the very DNA has very weak ionic bonds, it is communicating back. the molecules or the proteins are communicating back, you can fix it yourself and get your genetic information back again. Reinstate the integrity of the DNA again. So it's a two-way communication. And for a doctor to understand, we are doing it by MOs, NOPs, FOPs, all those factors wherein we are addressing each and everything. Again, while we are engineering the organ formation, we have to address some very important factors like we ensure that we put our patients in the hyperbaric chambers, and the very protocol is diagnose, detox, repair, and regenerate. So while we are diagnosing, we are ensuring that we connect all the dots. If he's diabetic, if he's cancer subject, if he or she is a pregnant woman, if he or she has a compromised immune system, so that we will ensure that we put all sorts of supplementation that is required. If at all they have a compromised immune system, we will go for a super transfer factor, which will enable the biologically immune system to fix itself, so that we attack the disease from every direction. And the factors we focus are the same foundations of the biochemistry. So, and those are, and there are the reasons why we also ensure that we put them in hyperbaric chambers and give 8 times more oxygen supply for the cells to mature or differentiate faster, along with the peptide protocols. This is all an attempt to address different layers of creation of life. Okay. I hope you will like a little bit of complication, and to take you into the energy factors and entropy and all those factors. So, creating life. Amino acids or enzymes, they have the capacity to catalyze a reaction, but do they have a universal capacity to catalyze all reactions? No. If, let us say it is just like this. If you are planning to go from Hyderabad to California, you consider Indigo Airlines to take you from Hyderabad to Delhi. But from Delhi to California, you need something bigger. So basically, if one amino acid intermediates in the making of a 30 amino acid chain peptide, it will not guarantee you the making of a 300 chain kidney peptide or made by different megamolecule structure. You require a different enzyme, timing it perfectly, and ensure you meet the demands of its oxygen and metabolic demand and catalysis requirement, everything. So that is where you will get the factors of deeper case study, or linking all the dots come into picture. Having said that, once after you do all this to reinstate the sanity of the organs and create them more and more functional, why do you address, or why do you tell them to change their lifestyle? Guys, evolutionary foundations. Even though you have a genetic code for a diabetic or cancer or anything, your lifestyle and the environment which you are adapting or accommodating for yourself, it has the power to overpower your genetic information. That is why we as doctors and scientists, we tell them change your lifestyle, because most of the diseases are lifestyle acquired. And that is the only way, because there is no point after reinstating the sanctity or sanity of your, or the integrity of your DNA and the organ, and you're going back to the same old nonsense and you expect, and you come to a doctor or a scientist to blame that you said this would work. Obviously it would work, but you should also get into census. So I will not trouble you with all the science. Light molecules. So guys, like I said, every biomolecular reaction or every biochemical reaction is enzyme specific. And the amount of results which you will observe and you will find depends upon several factors that will come into effect while you are addressing the problem statement of the patient. That could be many layers. One is giving the stem cells. The second is having it accompanied with the biopeptides protocol. Third, placing them in the hyperbaric chambers and ensuring that they are nourished with the supplements, ensuring that they get the lifestyle corrections done. All these factors in place will influence the very basic foundations of creation of the life, which are none other than these: bioenergetics, information pathways, and structure and catalysis, and cellular, chemical, physical, genetic, and evolutionary foundations. You have to target all these factors to ensure that your patient comes out with flying colors as a healthy individual. And that requires one brain acting, working on that patient, dedicating a quality amount of time to understanding the physiological mechanisms of that particular patient, of that particular subject. So, and having said that, I'm telling you all these things because just because we have done this, we achieved this. We do not have a magic wand saying that, okay, abracadabra, you got your foot back. No. We placed energy into it, effort into it, blood into it, brain into it. And that's how we are what we are. And because when you're asking a question, does it work, you're basically insulting the creation in itself, or the God in itself, whether or not, if God is right in designing the human being. No, He is right. We screwed up. So this is one of the studies of addressing the chronic degenerative diseases, wherein they understood that the cellular component of the selected renal cell platform can give a podocyte or a parietal epithelial cell transcriptome, which means the cells which we extract from the kidneys and we culture them, or when we ensure that they become functional, if you see that fluorescence spectroscopy, they are firing there. Yeah, you see this image where they're firing and all. So, and if you see here where both the macromolecular structures and the genetic information, they're communicating with each other to ensure that in a complete organ, they express the parietal epithelial cells, which are fundamental in making the kidney. And this is one more study which is published in the American journals, where even the cells extracted will also have the capacity to give out a renal tubule. And this is another research article which we have taken, where the renal autologous cell therapy in type 2 diabetes with late stage 4 diabetes-related chronic kidney disease. In this particular study, it is very clear and evident that yes, stage 4 kidney disease patients can be brought back. And now we are venturing into stage 5, which my mentor, who has already addressed the stage 5 patients too. However, like I said already, every patient is different. It is not necessary one stage 5 patient is completely back, the other stage 5 patient will also be back. You have to put your effort and energy into it. But one thing is certain and clear and evident, that yes, he can be brought back. But are you going the right direction to bring him back? That's for you to figure it out by putting time, effort, energy. But yes, body has the capacity to come back, provided we fix 5 factors and address 3 statements: physical, chemical, genetic, evolutionary foundations, and enzymatic foundations. These are the 5 things which you have to target while you're designing the protocol. And the very 3 things which you have to focus on is this. Structure and catalysis, bioenergetics and metabolism, and the information pathways. When you are successful in addressing these 3 things, I'm very certain to say that you are successful in addressing the problem statements of your patients, no matter what the disease it may be. We are certain, because when I was studying my advanced guidance physiology, I used to look into the docking complexes of the brain and used to say, oh my goodness, what's such a delicious complexity. It would have taken a great deal of time for the guard to build each and everything, giving it a thought to every minor detail. So, guys, the only way we can make it work is by focusing on the details of your patient. Understanding the physiological mechanisms, how they are working in your patient, and then designing the protocol according to the patient. And yesterday I had a conversation with one of my fellow doctors wherein he said that allopathic medicine is not something, it's a universal medicine. It's not something subject to subject tailored, but no. We made it universal because we did not have time to tailor it to that patient. But even allopathic medicine has to be tailored to the patient needs. And whether or not, we will not give a drug which is contraindicated to a pregnant just because she has diabetes or cancer. We should take that she is pregnant, her pregnancy into consideration before you write a drug, and weighing out the contraindications as well. So, by definition, allopathic is also subject-centric and subject-tailored. And it is the same way with the bioregenerative medicine too. And this is no future, it is present, given the time we have to address our patients. So, from now onwards, me and Dr. Shri and our global doctoral team, we decided to take some time to give constant webinars and seminars to our doctoral and scientific fraternity in India as well. Doesn't matter wherever, whatever the part of the world we are in, we will make sure that we'll because I'm sure that getting into the detailed complexities of the technology, not everybody would be interested in getting it, but those who are really serious and passionate, it is important that they understand the details. And we will be certain that we will allocate these interactive sessions with our scientific and doctoral fraternity weekly, monthly, so that now that we are launching the application called the Loop, we will ensure that we are all in we all have a seamless access to all the scientific literature or the technology and the protocols. We will work together towards our patients. When we all come together, it's easy. It's hard for one guy, but it's not hard for an army. So, like they say that Nelson Mandela says, God is always on the side of the biggest battalions. I really hope all the doctor and scientific fraternity becomes a battalion so that God is on our side in addressing the patients. Thank you so much.
Thank you, Dr. Ravi, for your insightful session. Now we call upon Professor Dr. Olga Nishkumai, who will provide us with up-to-date approaches to the prevention of bone senescence and vascular calcification. The lecture is about information about cardiology.
Good evening. It is thrilled to be here again. And today my lecture will be about the inflammation in cardiology in terms of bioregenerative management. I did choose this topic of lecture because I'm 25 years experienced cardiologist, not satisfied with the results of conventional medicine in terms of cardiovascular diseases treatment of our patient. Because despite of many molecules, many technologies, devices for treatment of our patient, the cardiovascular diseases still stay on leader position in structure, mortality and morbidity. What eludes our understanding of this problem, and what should we do more for our patient with cardiovascular diseases? But first, I would like to ask you, how do you think, what is the most important organ in your body? Because when I had lecture in Gentleman Club in Kota Kinabalu, inside of men, I heard different answer, but I think this is heart, because heart arrest means organism dead. So aging, the main reason for different diseases is special cardiovascular and cerebrovascular diseases. So what can we do for cardiac longevity? So today we'll speak about the main cardiovascular risk, main enemies for cardiovascular longevity. Cardiovascular diseases like myocardial infarction, myocarditis, essential hypertension are the most common causes of heart failure, results in the death of 1 billion highly specialized cardiomyocytes. And replacement of these dead cells transform to the cardiac fibrosis and cause the cardiac failure. So the cardiovascular disease is the world #1 killer, especially due to atherosclerosis. What are the main risk factors for atherosclerosis? It is our lifestyle, so it's smoking, it's obesity, it's fatty liver disease, it's low physical activity, it's diabetes, also genetic predisposition, very important, hypertension, dyslipidemia, and very important also some risk factors like dysbiosis. So, but according to the recent research, the main reason for cardiac senescence and general senescence of our cells is inflammasoma formation. Because inflammasoma can release the procaspase-1, procaspase-1 can release the dead protein gasdermin, and gasdermin causes the pores in membranes of cells. And this causes the cellular apoptosis. And for this protection of this process, it is very important the healthy mitochondria. It's main organelles which produce the energy for cells. For mitochondrial function, it's very important the normal level nicotinamide dinucleotide and sirtuin as the main enzyme. That is why our company can offer for you the special product, NMN Cells Revitalizer, which contains the nicotinamide mononucleotide and also the resveratrol, like the huge antioxidant. But if we answer for the question, what are the main enemies for myocardial longevity, it's based on the 4 main pillars. So it's oxidative stress with the release pro-inflammatory cytokine, it's mitochondrial dysfunction, and also its dysbiosis, because due to dysbiosis can release the toxic substances like trimethylamine, and this also enhances the low-grade inflammation and cause the vascular dysfunction with induce the atherosclerotic process. So this looks like a visual circle. It is very important the influence of dysbiosis to myocardial injury, because due to dysbiosis can cause activate the monocyte migration, and monocyte migration can cause the microvascular dysfunction and microvascular injury. And cardiology is aware about how difficult to treat this patient with microvascular dysfunction. We cannot resolve the problem due to stenting, due to garbage. So it's very important to prevent dysbiosis in our patient. That is why we have the huge product, the GI proenzyme symbiotic, which consists of the proteolytic enzymes with the bromelain and papain, and prebiotic and probiotic. How looks this inflammation? So it's not only pro-inflammatory cytokine, but also it is disbalance between two types of macrophages. Between activation of M1 macrophages, it's pro-inflammatory, which releases the pro-inflammatory cytokine. This consumes the nicotinamide dinucleotide. And weak functioning of M2 macrophages, it anti-inflammatory macrophages, which release anti-inflammatory cytokine, and also due to macrophages 2, it can clean our cells from intracellular garbage due to cells apoptosis. So this is a difficult scheme. How looks the inflammation and reason for cardiac senescence? So it's like disbalance between macrophages, this activation of inflammasomal formation, dysbiosis with releasing the toxic substances. Due to the weakness of M2 macrophages, it accumulates in the intracellular garbage and forms the damage association molecular pattern. This activates the receptors of low-density lipoprotein, PCSK9. So it activates the genomic instability, oxidative stress, metaflammation. So it looks like visual circle. And this inflammation causes the denervation of heart. And how impact this denervation of cardiac function? So it can reduce the heart rate variability. It can lead to silent ischemia and lethal arrhythmias, and cause the disbalance between sympathetic and parasympathetic nervous system. So what is the solution? Solution, first of all, we need to assess the cardiovascular risk. And for this purpose, we have the many tools, and recent the SCORE2 calculator, when we can assess the cardiovascular risk of group of risk our patient. And we know if we have the special group of risk, we should manage the target level of low-density lipoproteins. And also very important to decrease the low-grade inflammation. It's simple. It's a physical activity, at least 300 minutes a week, and also Mediterranean diet can help our patient to prevent this cardiac senescence. Other lifestyle modifications, stop cessation, stop smoking, alcohol consuming, and manage the cholesterol level, glucose level, blood pressure. And if our patient has the high-risk group, so we have to prescribe the antiplatelet and statin therapy. But despite the positive effect of statins, they can decrease the morbidity, cardiovascular morbidity and mortality up to 20%. They have them side effects. It's not only weakness of muscles or increase the liver enzymes. It also, due to the competition through the mevalonate pathway, it can decrease the amount of coenzyme Q10. And coenzyme Q10 is the main coenzyme to normal functioning of mitochondria. And that is why we have the many product with a Q10, and it's very important. If our patient have to take statin, for example, after myocardial infarction, after stenting, after stroke, so we need to know that supplementation of Q10 very important. And for this patient, we need to recommend the high level or high level of daily consumed the Q10 up to 200 and 400 milligram daily. I'm very happy that also and convention medicine focusing to the problem of inflammation, because now ongoing the clinical trials with effectiveness the some monoclonal antibody anakinra, canakinumab. This is medicine we use in rheumatology to treatment the autoimmune diseases like rheumatoid arthritis, and this study tried to explain what the influence this medicine to inflammation and main cytokine which involve in cardiac senescence. And I'm very happy that the colchicine, which already confirmed the positive effect in terms of inflammasomas, and colchicine already includes in recommendation for cardiovascular prevention. What other products in terms of bioregenerative medicine can help to prevent the cardiac senescence? It is phosphatidylcholine, and Dr. Simon already explained the effect of phosphatidylcholine. Phosphatidylcholine includes in the component of whole membranes. It can be as a precursor of acetylcholine, so improves the neuroplasticity, and also can modulate the disbalanced lipid profile, and also includes in bile components to prevent the dysbiosis. So we have also many products with other phosphatidylcholine as alpha-choline with combination alpha-tocopherol, so it's a huge antioxidant, and also the omega-3 fatty acid. In previous recent the meta-analysis have shown the positive effect not to cardiovascular death, but also death from any case. And this is very important. That is why we also have the component, this product in MC Evolution, our product, with a combination krill oils and also coenzyme Q10. Next very important component, quercetin. Quercetin can decrease the activity of inflammasoma formation and pro-inflammatory cytokines. That is why this quercetin includes in our product like Longevity Essential Pro and Swiss Evolution SP Improved formula with another components, antioxidant, and can reduce the cardiac fibrosis and prevent the ischemia and arrhythmias. Another bioregenerative product like Camphorol has an anti-inflammatory, anti-tumor, and even proclaimed as a phytoestrogen effect. And this product includes in our inflammatory response support formula, Swiss Nature. And resveratrol, you know, this resveratrol can be like source from grapes, wine, pine nuts, soy, berries, and the resveratrol has an anti-inflammatory, antioxidant effect, and also that can increase the level of nicotinamide dinucleotide and sirtuin level, its main component for prevention of senescence. That is why this component includes in our product telomerase activation and VP advanced formula. Also, we have the Active Essential Pro with many antioxidant, zinc-like component for normalization of immune system, and also zinc very important to enhance the testosterone level, as a betaine, as a magnesium maleate, for improve their cardiac health. Yesterday I had lecture about the vitamin D influence, and recent meta-analysis have shown that low vitamin D level is associated with cardiovascular diseases through the metabolism of vitamin D, and due to low level vitamin D, it causes secondary hyperparathyroidism, with increase the calcification in media, so it's increased the vascular stiffness, and this moment includes in the high potential of cardiovascular morbidity and mortality. And also other vitamin K2, menaquinol, has many influence, but it termed the problem of vascular calcification and can convert glutamic to carboglutamic acid and prevent the calcification of coronary arteries, that's which come from in Rotterdam study. That is why we have the immunovite. It's combination the vitamin D plus K2 with vitamin D dose 5,000 and vitamin K 100 milligram. So the main ways to prolong longevity based on the 4 pillars. So it's a correct diagnosis, it's detox therapy, repair, and rejuvenation. And we need to rejuvenate from the cellular level, which proclaimed the previous lecturer. And stem cells therapy is a new perspective which can help to prolong the cardiac longevity. So there are different types of stem cells, we already talked about it, and very important, the stage of differentiation, and unipotent cells very benefits in this direction. But we know that the history of stem cells start from the bone marrow stem cells and 2 main branches like hematopoietic stem cells and mesenchymal stem cells. If we dive into history of stem cells in cardiology, it starts from skeletal myoblast. But in experimental study have shown that this type of cells cause the arrhythmias. The bone marrow stem cells and main branch hematopoietic stem cells mostly used for a patient in oncology after chemotherapy. But hematopoietic type of stem cell CD34 in preclinical trials have shown the positive results in terms of improvement of fraction injection and improve the forecast for cardiac failure. So mesenchymal stem cells has a general paracranial effect and anti-inflammatory effect and cannot maturate the special cardiomyocytes. Embryonic stem cells in previous preclinical trials have shown the high level of probability teratoma formations. It is why in terms of cardiology now not the benefit for these cells. Induced pluripotent stem cells also had some trials, and these stem cells which can derive from somatic cells and then obtained by the reprogramming and then by stimulation can maturate to the special type of cells, but also these 2 types of transformation we cannot understand what exactly the prognosis after this stimulation the cells. That is why precursor stem cells looks very benefit in this direction. There are many trials, other experimental trials, other even clinical trials was conducted in terms of understanding the influence of the stem cells in cardiology. And mostly it was direct to the improvement of ejection fraction, so improvement the prognosis cardiac failure. And very interesting that last year in March was published the results of phase 3 DREAMS heart failure trial. It's a clinical trial, so the participants patient amount of 500 patients. It was published in most popular journal like JACC journal. So, and these results of precursor stem cells have shown improvement not only ejection fraction, but also reduce the cardiovascular mortality, myocardial infarction in stroke in patient with chronic heart failure. So it's very important results. So it open new opportunities for our cardiological patient. So to overcome the main barriers to transplantation like arrhythmogenicity, engraftment, and immunogenicity, better use the organ-specific stem cells because it can maturate only to cardiomyocytes. It also very important not the type of cells but also the methods injection because previous preclinical trials have shown that in intravenous injections the stem cells can be entrapped in lung vasculature, so they can shorten the therapeutic life of stem cells. In intracoronary injection, the preclinical trials have shown the high probability of coronary obstruction of coronary circulation. Multiply intravenous and intracoronary methods due to very invasive techniques also was not widely exist. Transendocardial injection have shown the distribution of mesenchymal cells less to visceral organs compared with other modalities. And these delivery methods like retrograde coronary venous injection, it's more real platform for stem cells, but it's very invasive, like as intramyocardial route. So the intramuscular injection looks more minimally invasive and looks like really benefit and like alternative to compared to the conventional intravenous infusion for application. So we have the clinical potential of regenerative medicine as a cells-based therapy and no-cells-based therapy, it's exosomes. Yesterday, I explained the exosomes. It's extracellular microvesicles which help to communicate each other the cells. And main function of exosomes is they carry the special microRNA. And it is very important what kind of microRNA can be carried by exosomes because some of microRNA can induce like hypertrophy, like fibrosis. Some of them can prevent and inhibit cardiac fibrosis. So the exosomes can be as a tools for diagnostic, as a tool for gene engineering for prevention of cardiac fibrosis. Like support therapy, very important, the combination therapy with mitochondrial organ-specific peptides, like mitochondrial organelles and nano-organopeptides. And as a convention doctor, I believe only when I receive some really practical results. And I would like to show you the real clinical case. My patient, it's 72 years old. This patient had the coronary stenting in 2010 without any infarct because it's performed the angiography and it was the indication to the stent implantation. Then he had the 2 myocardial infarctions, that is why also had the GAPCH. Also, this patient has the atrial fibrillation, that is why he had the ablation. He has the essential hypertension and heart failure with preserved ejection fraction. So this is a list of medication. And after GAPS, the patient still complains about the dyspnea. And the cardiology and practitioner knows that dyspnea, it's not specific only for cardiac problems. So it's not only like ischemia. It can be typical for many diseases like heart failure, like lung problem, and like ischemia, like cardiac failure. So if patient still complains about the dyspnea, we recommend the stress echocardiography, and on the dose 10 milligram dobutamine, we reveal there's some region of ischemia. That is why we make decision about the stenting, because he had the 90% stenosis. But even after stenting, the dyspnea ongoing. So then my patient asked me, doctor, what should I do more? Because all list medication, all the possible and impossible methods, and quality life not good, not so stay like before. So I say only stem cells and try to start from peptides in simple. And we shipped this our peptides, a more hard and a more mesenchymal cells for 3 months. And after that, he called me and say, doctor, I'm okay. I have no dyspnea. And I said, I cannot believe. You should pass some examination. Please do the treadmill test, and after that, one more we'll discuss about it. And after that, he passed me the results of stress test. So before he can pass only 4 meds, and after treatment, he can pass all 9 meds without any complications. So I say, oh, I also believe in this work. So we have the many possibility for our patient, and I would like to finish my lecture with a quote the Lao Tzu, that the most distant path begins with the first step. And as is my favorite singer, Frank Sinatra, said that I did it my way, so we have also own ways. And what will be next step, I think it will be confident. Thank you for your attention.
I got a doubt actually. As you said, for the cardiovascular problem, the bromelain and papain enzymes were given to increase the microbiota, and further it is increasing their heart health. But for a pregnant lady, if she is diagnosed with a cardiovascular disease, do bromelain and papain are given or not? I wanted to know
that. Stem cells or what? What exactly question about? Can you repeat question, please?
As you said, for the heart problem, to increase the microbiota, you said about the relation between microbiota and heart health. The bromelain and papain enzymes were given to increase the microbiota and to increase the heart health further in good way. But for a pregnant lady, especially in Indian context, they don't give papaya and pineapple, which is the enzymes produced by the bromelain and papain. Would they be given if they had any cardiovascular disease? I'm asking. Yes.
So, in terms of the dysbiosis in pregnant women, yeah? Your question
Yes.
with combination and possibility they use these components, right?
Yes.
Generally, the pregnant woman, it's a different and separate part for investigation and for implementation our recommendation. My lecture contains the general information about the prevention. So the special pregnant women should be managed together with teams with gynecologists, obstetrics, and cardiologists together, because there are many additional common diseases, can be like contraindication and restriction for many supplements. So I think the pregnancy it's separate. So we need to exactly review the special case and then look what kind of supplements can be recommended or cannot be recommended, because pregnancy it's separate. I think.
Got it. Thank you.
Now any question?
Thank you, Dr. Olga, for your insightful session. Now we have Dr. Margarita Emilianova via video, because of due to some logical constraints, she was not available today. She was here to discuss about biohacking in female patient and bioregenerative management, part 2.
My talk devoted to estrogen dominance and the ways to address it from the standpoint of regenerative medicine. These beautiful Eustoma flowers I picked to put on my title slide, not accidentally, but because they strongly remind me uterine fibroids during the surgery, when you perform the hysterectomy, cut out the removed uterus, so they look exactly like this. You may see on the following picture. So uterine fibroids appear to be one of the classic examples of condition which are resultant from the estrogen dominance imbalance. Estrogen, they are necessary evil for human health and how to tame it. Being in the center of all the functions in the human body, regulating so many metabolic processes and major functions in our body, including glucose homeostasis, immune system, bone health, cardiovascular, fertility, neural functions, and many, many others. It appears to be very potent clustergen, morbidogen, and carcinogen, causing at meantime infectious, degenerative, autoimmune, and metabolic diseases. There are 4 types of estrogens known that exist in the human body, and it depends on the amount of hydroxyl groups. There is estron, estradiol, estriol, and estetrol. Estradiol is the predominant hormone existing and performing all the important effects in a female body during the reproductive life, since 15 to 49 years old. And estradiol appeared to be 10-fold more potent than estron and 100-fold more potent than estriol. During pregnancy, the major hormone is estriol, and women experience all the effects from it. During the menopause, the predominant circulating estrogen is strong, performing its effects. Estradiol E4 is being produced only in the pregnant organism, female organism, by fetal liver, starting since 9th week of gestation. Here you can see the major sites of production of the estrogens in the human body. And of course, in female, it's the ovaries and placenta, but also other sites of production that we can list are adipose tissue, adrenal glands, bone, liver, pancreas, brain, skin, breasts, and testicles in male. In the left part of my slide, you can see the flow chart of steroidogenesis. And in its right lower corner, in the pink color triangle, you can see estrone, estradiol, and estriol, the estrogens that appear to be derivatives of androgens such as testosterone and androstenedione. And it happens majorly in the ovaries. Of course, later I talk more about the specific sites of the synthesis, but we should mention that the estrogens can be synthesized only converted out of androgens such as testosterone and androstenedione via reaction which is catalyzed by enzyme aromatase. So please bear in mind and memorize this fact. As I said, the major place of synthesis of estrogens is the ovaries in female body, and the first reaction of synthesis, steroidogenesis, conversion of cholesterol into androgens, is taking place in TICA cells, and TICA cells are present only in the secondary follicle and pre-ovulatory follicle. That is why on the stage of secondary and pre-ovulatory follicle in the follicular phase of menstrual cycle, we observe the highest levels of estrogen in the blood, female blood, during menstrual cycle. And as I said, the reaction of conversion of androgens into estrogens catalyzed by aromatase enzyme take place already in the granulosa cells. So internal layer of the cells that is adjacent to oocyte. And the final here also should be mentioned that reaction of synthesis of androgens is promoted by luteinizing hormone, and the reactions of synthesis estrogens is in follicles is promoted by follicle stimulating hormone. Estradiol can be converted to estrone, a less active form of estrogens, and also can be converted in the estriol, another less potent form of estrogens. The biological role of estrogens in a female is then they're responsible for the development of female secondary sexual characteristics during puberty, such as breast development, widening of the hips, fat distribution. They're also responsible for mental health, for promotion of cognitive function, for bone health, immune system, performing immune protective function. They also regulate lipid metabolism, increasing HDL, triglycerides, and fat deposition, and many other functions. And in the female body, estrogens are opposed by the progesterone, which is extremely important. And this balance is crucial for normal functioning of female organism, because progesterone, unlike estrogen, performs opposite effects. It downregulates estrogen receptors. It promotes apoptosis and cell differentiation. It initiates ovulation and induces secretory transformation of endometrial lining, preventing it from the overgrowth in the hyperplasia or worst case adenocarcinoma. And it also inhibits uterine activity, which is extremely important during pregnancy, preventing the preterm birth and miscarriages and all in all. So next, I would like to explain a bit on estrogen metabolism and its excretion. So what happens? First, out of cholesterol, the precursors of estrogens are being produced. Next, they aromatize to estrogens. Then estrogens perform their effect binding to corresponding receptors, alpha and beta. And what's going on next is the phase 1 and phase 2 detoxification of estrogens in the liver. Via first phase, fat-soluble toxin such as estrogens in our case converts into activated intermediate by hydroxylation reaction, which are catalyzed by cytochrome 450. And next is phase 2 detoxification in the liver, which converts the intermediate, this activated intermediate, to water-soluble compound via conjugation, methylation, glucuronidation, or sulfation processes. All of them called actually conjugation, but can be performed in a different ways. And the most prominent is methylation. Maybe the most important is methylation process of liver detoxification via during phase 2. After being conjugated in the liver and becoming inactive form, the estrogens are being excreted into the bile and urine, and after that evacuated from the body via kidney and intestine. But here there is an important fact that we should highlight. Our gut microbiome, bacteria living in the small intestine, around 40 strains to convert inactive form of estrogen conjugated via so-called reaction deconjugation back to the active form and return it back to the bloodstream letting them bind again with receptors, and this become one of mechanisms of the estrogen dominance. So conditions such as bacterial overgrowth or fungal overgrowth may be favoring to the estrogen dominance. And also later on, I'll be emphasizing very much on maintaining and promoting the gut health and how important it is to have balanced bacterial microbiome in our body. Reaction of deconjugation, once again on the slides. So what's happening, those bacteria, the one I mentioned, around 40,
First of all, thank you so much, Boliset Satyanarayana Garu and Mr. M. Ratnam Garu and Sunita ji and all the dignitaries and Sir Shailesh Hiranandani also, who has joined us online. So, we are going to launch the web application right now. And we are going to ensure that we also launch the Indian chapter of International Association of Cell Therapy and certify our doctors and physicians. And then the open in the organization called the Lesser Child of the Greater God. Ee naalgu ippudu jarugutai. So, guys, shall we launch it one by one? Mohi, can you please orchestrate the launch? So, Kiran, if you can come up, or Deepak, if you can come up. So, Mulsetti Garu, this is our web application, and we will demonstrate slowly how the application works. If you can launch it, saying just launching the loop, you can. There's something. Yeah. Open the link of the website, web application.
Ladies and gentlemen, I have privilege to be here. All of you are enriched with your knowledge and experience and all scientists and all. I am actually an environment activist and also a secretary of a party called Janasena Party. So we consider environment is the most important aspect. As a political party, I don't think any other party in the country or in Asia which consider the environment is the most important aspect. And you are the people doing something great for the society, and I always admire the scientists of the society. And earlier days, ancient days, our kings used to fund the research. Now there is nobody there to fund the research. So the research is going down, and ultimately the corporates have taken up the research and doing something. And there are two ways of corporates. One is doing for themselves and doing for the society. I hope you will achieve both. You should also survive, and also you should help the society to survive. But in a small note, I would like to mention on behalf of novice people like me, the innovation always have some side effects, and that will be known only after 3-4 decades. So we can't wait for 3-4 decades because something is sitting on our head, so we need to find a solution. Just an example, in the US, there is a person they identified to add compound, lead to the fuel to reduce the knocking noise of the petrol engines. That has brought a big revolution in American automobile industry, and they become global leaders. Later on, they found the lung cancers increased. And they found the reason for the lung cancer is the lead in the air, which has come out from the emissions of the automobile. So unfortunately or fortunately, what has happened is the person who introduced the lead into the fuel got the Nobel Prize, and also the person who said it is wrong got the Nobel Prize. Yeah. So science is something like a quest. We want to know the truth, how the whole universe is working and how the life is working and how to improve our lives. In the process, something sometimes goes wrong also. We should keep that in mind. And sky is the limit, because society needs you, and needs you more than earlier, because nowadays all the problems are coming and they're not waiting like COVID and all. They don't wait 30 years of testing or 40 years of testing, because otherwise people won't exist on the earth. So thanks for all your innovations, and thanks for Dr. Ravitej allowing me to come here and be in front of you. And also I'm very proud and happy to be here with my friend called A.M. Ratnam, who is the greatest producer of Indian film industry, and I think he is the #1 film producer of the country as of now. And he is going to produce another movie called Harihara Veeramallu, who is the president of our party, is acting as a hero. So I just would like to mention, and thanks for all the help and support, and Suniti garu to you also, and the two team, and Dr. Mike and Dang, Dimitro, Dr. Ravi Allam, I know. Thank you very much.
Dr. Simon and Dr. Olga.
Dr. Simon and Dr. Olga, thank you for all of you. And I came here actually from Andhra Pradesh. My flight is delayed by 2 hours, so I was here late, and my apologies for that. And I would like to say, on behalf of Andhra Pradesh, we are going to give you the best place that is suitable for you, because we have 900 kilometers long sea coast. It's just like San Francisco of the world. This is the best sea coast in the country we have. And we will give you the best place suitable for your research and your development and all, on behalf of the government which is going to be formed, and on behalf of the present government also, because that's how I am, and I can help you to get the best out of our state. Thank you.
You talk.
Well, suddenly he gives the mic. I'm not prepared for this, but I just have to say that I'm quite feeling privileged, humbled to be among such well-learned, knowledgeful, and most importantly, a group of people that are trying to do something phenomenal to the future of the humanity, whether it is politics, which is so much needed, and the patronage is needed for research, and I'm in the company of such great scientists. And somebody I look up to in storytelling, and somebody who I have grown up admiring, A.M. Ratnangaru. What I would like to say is that my presence here, more than a storyteller or a producer, is a concerned cancer survivor, and I'm a twice cancer survivor. And it's very important that this kind of personalized technology is so much needed for the humanity going forward. If you see many things that are talked today, whether it's inflammation, chronic diseases, liver detoxification, and kidney failures, these are the things every human being is facing today. If you take the entire families of the world, every family in the world would have faced this problem. And most importantly, the concern that I have is the kids that are being born within the spectrum and autism. I think that's the need of the hour. If you look at my growing up, for instance, if my family have never seen autism, in my own family and friends, there are 10 to 15 kids born on the spectrum. So this is a huge concern right now of the humanity. I think in the presence of all these people wanting to do good for the humanity, I think we should feel very humbled that they choose our state, our country, and Dr. Ravi for bringing them here, and Dr. Shri for willing to come to this country and to help us, and Dr. Dimitri, and Dr. Alga, and Dr. Simon. Thank you very much. And thank you for helping us and supporting us and giving your knowledge and guidance. Thank you so much.
And one small thing I forgot to tell. One small thing I forgot to mention. Bring out our ancient knowledge and wisdom into your modern science. You know, there's not only Ayurveda, and even surgeries, and also what you call this bio-remedies, whatever it is there in the past. So it is depicted in Talapata Granthas, the palm leaf, descriptions are there. And that has to be linked up with the modern science. You know, actually we have ancient knowledge in China and in India. We have the best ancient knowledge about the science, most modern science, which can be linked and correlated. I think you should take that advantage, and our Prime Minister is very much interested in linking up these two things. The Ayush and other things, what is they're talking about, is all about the Indian ancient 5,000-6,000 years old medication. And that let us link it up with the modern, so that we can have the best of both worlds. Thank you.
I just want to add to that as a filmmaker and a storyteller, we published a book called Ayurveda Chronicles. And I am a huge speaker on Ayurveda because it's the second cancer I took Ayurveda to save myself. With the help of one of the most well-known doctors in India, and I'm very grateful to have been guided by him. And I'm right now in the process of making an animation movie on Ayurveda, so that the Ayurveda can be taken to the world. And I like to take all of your blessings to take it forward and show the greatness of our most ancient medical science of India. Thank you.
Another half minute for me? Yeah, Another half minute I am taking now. See, I am also a survivor of a lung infection. Actually, I lost both the lungs. One lung 100% and other lung is 75%. And doctors gave me the life of 2 weeks in 2021. 2001, not 2021, 2001. And I took some Ayurvedic medicine, and it is regenerated by both the lungs, and it's become normal now. So there are things which are happening thanks to the Germany with this Ayurveda. I mean, the Homea has come from Germany, and I'm the survivor here, and doctors gave me 2 weeks life, and I'm here after 2 decades. So this is the medication, and this is the miracles do happen. So I wish that you can do wonders for us. Thank you very much, and let us work together. Thank you.
So please say a few words. As a danger cheppala mundu. Sir, we are all scientists and doctors. So basically, there is something. So right now there is technology, which is called the bioregenerative medicine technology. ఈ టెక్నాలజీతో ఏదైతే క్రానిక్ డీజనరేటివ్ డిసీజెస్ ఉంటాయో, కిడ్నీ డిసీజ్, డయాబెటీస్, ఎల్జైమర్స్, చిన్నపిల్లల్లోని ఆటిజం, డౌన్ సిండ్రోమ్, సెరెబ్రల్ పాల్సీ, వేటికైతే మనం ఇంకా వీళ్ళకి ఏమీ చేయలేం. అనుకున్నామో ఒకప్పుడు, now we can do something about them. వాళ్ళ ఆర్గన్స్ని మళ్ళీ బ్యాక్కి తీసుకురావచ్చు. To a point, we have also encountered our scientists who created urinary bladder, complete organ and implanted it. మనకున్న ఇప్పుడు హెల్త్ సినారియోలో రెండు ప్రాబ్లమ్ స్టేట్మెంట్స్ ఉన్నాయి. ఒకటి క్రానిక్ డీజనరేటివ్ డిసీజెస్, ఇంకొకటి ట్రాన్స్ప్లాంట్ వరకు వెళ్ళిపోయిన వాళ్ళకి ఆర్గన్ ట్రాన్స్ప్లాంట్స్కి కావాల్సిన ఆర్గన్సే లేవు. నౌ ఇప్పుడు ఆ రెండు ప్రాబ్లమ్ స్టేట్మెంట్స్ని మేము మాత్రమే అడ్రస్ చేయగలుగుతాం. Total, when it comes to the world, kidney disease, 2 companies are addressing. My company and there is another American company. But when it comes to other problem statements like autism, cerebral palsy, Down syndrome, diabetes, ivanni only మేము మాత్రమే అడ్రస్ చేయగలుగుతున్నాం. And we are stationed in Germany, and that's my mentor, Professor Dr. Mike. And I've learned both science and entrepreneurship, both from him. And thanks to my another mentor, Dr. Shailesh Hiranandani, who is very close to, who is one of the India's biggest unicorn, a $45 billion portfolio. He's investing into this project, and he ensured that he promised us, Amit Shah garto gani, with the Prime Minister Modi ji, he also had into discussions, ee technology India ki ravali, ani he had the discussions, and he ensured that earlier today he came into the video call with us, and he told us that whatever the support you need from the government infrastructure or from the regulatory infrastructure, I will ensure that I'll get it done. And whatever the money muscle you need to bring this technology, we are promising and we are ensuring that it will happen. And likewise, we are also joined by many other investor partners during this event who said that, sir, this technology is amazing. It has to come to our people. And now that we also have Mr. Bolisetti Satyanarayan Garu promising us a very land or any infrastructural support from the state of Andhra Pradesh, soon they form the government. And with Mr. Kalyan Garu and him having the same line of thought process that we share towards the Indian Disease Index or the Health Index of our people, which are in common lines with the Prime Minister of India. So, because when during my last visit, when me and Dr. Shri went to, basically when we met Shailesh Hiranandani in Malaysia, when he has come to our center, I was there when Amit Shah called him. I was right next to him and they were talking and they said that, okay, we will do this. And it was not an orchestrated call, it was just happened on time because he came to us for treatment. Our doctors, Dr. Olga and Dr. Margarita and Dr. Shri, we all implanted the cells for him, treating him. And even Sunita Garu has earlier, she has witnessed him saying that it worked for him. So I'm glad I had these many mentors around me in bringing this technology. So idi jarutundi, sir. And right now, today we are launching 3 to 4 things. One, ఇప్పటి వరకు ఇండియాకి చాప్టర్ లేదు ఇంటర్నేషనల్ అసోసియేషన్ ఆఫ్ సెల్ థెరపీకి. సో థ్యాంక్స్ టు డాక్టర్ శ్రీ హూ సెడ్ దట్ హీఈస్ ద చైర్మన్ ఆఫ్ జాపనీస్ సొసైటీ ఆఫ్ బయోరిజనరేటివ్ మెడిసిన్, అమెరికన్ సొసైటీ ఆఫ్ బయోరిజనరేటివ్ మెడిసిన్, అండ్ యూరోపియన్ సొసైటీ ఆఫ్ యాంటీ ఏజింగ్ అండ్ బయోరిజనరేటివ్ మెడిసిన్, అండ్ ఇంటర్నేషనల్ అసోసియేషన్ ఆఫ్ సెల్ థెరపీ. ఆ అసోసియేషన్స్లో వరల్డ్ రినౌండ్ సైంటిస్ట్ అండ్ డాక్టర్స్ ఉన్నారు కానీ మన ఇండియన్ చాప్టర్ లేదు అందులో. He said that, Ravi, I will ensure that today we will take this opportunity to start the Indian chapter, and we will take the doctors from here and have them be part and parcel of the Indian chapter. That's number 1, sir. And number 2, we are launching the application called the Loop, which will enable, guys, can you please present the Loop? We are launching the application called the Loop, where doctors and scientists from around the country can get into this application and register directly and have a seamless access to us, where a patient can get in, present their blood work, present their medical questionnaire, where our doctors can look at their blood work and everything and come back and say that this is the protocol. And similarly, scientists from different research incubations can work with us and share that. Exactly. And when it comes to our corporate social responsibility, it is long dreamt by my mentor that an organization called the Lesser Child of the Greater God, where there is another IT platform which we are designing, where parents of all the children who are suffering from autism and cerebral palsy, they can also register and have an access to our doctors and our technology. And in Hollywood, Giga Habib is taking this initiative forward because she has a personal experience. And earlier today, my mentor said that one of his second child, he has overcome the agony of his second child and curing him the autism, and wherein now he's an independent person. So this is the organization we are and the platform we are creating for the children of autistic and Down syndrome, wherein we have a special quota where we can treat them free of cost every year, some children. So that should be, we are also looking for a proper person who has an empathy towards children to take this forward, take this initiative forward, the lesser child of the greater God. And so that is how I approach Sunita ji, saying that I need people with good heart to launch it. And I'm glad even universe has brought you in to ensure that this happens.
There is a great mix of science and the arts, you know. There are two movie makers who actually made beautiful movies. There is a movie called Genes, which has got some sort of connection what you are talking about. He made the beautiful movie. And look at that side is all the foreigners and scientists, and this side is Indian scientists and Indian people are there. Without knowing each other, we have separated the cells, you know, like stem cells, we are separated, you know. We are together on the same stage. This is the link. I agree. So thank you very much, sir.
So Adi sir jarugutundi. So I thought you should know something so that before you say some good words about it.
So I am here to privilege and unexpectedly came here. So I am glad to meet all of you because in the world, highest population after in China, India is the population more. So we are doing service for the people. See, earlier the corona came to India. People thought 10 crores people will die. But we saved the people, our country, Prime Minister, and we supply the medicines for other countries also. So earlier, previous what he said, 5,000 years before, there is in Second World War, there is a Talapatra Grantha, there is in Sanskrit. So many medicines, weapons, all our rishis, they are written. In the Second World War, the Germany people and other Japanese took that everything from here. And they made the medicines and weapons, all this thing. Our history is like this, India. So very glad to come to our Andhra Pradesh, Western East side. We will support from the government and everything. It's very glad to here. I am here. Thank you.
So actually, he is a great inspiration for many people. And I'm sure whatever he promised, he'll deliver much more than that. He is making movies of like $100 million, like that. You know, he is not a small producer. He's a big producer of world-class movies. So he has access to many important people who can influence the world. So that is what he can bring it to our table. And
Dr. Shri, the biggest films the Indian has ever conceived is made by this man. So only he can get it. He can call him Rajnikant. He can call Rajnikant right now. So he made all the biggest productions in India. So now he's making even more bigger because I always believed one line, sir. There are only two people who live the life to the fullest. One is the scientist and the artist. Scientists because they know the handwork of God. Artists because they know the heart work of God. So So when I wanted this initiative to come in, I know very clearly that India is an entirely different country. And one day, Professor Swaminathan said to me, Ravi, go out and ask about who knows Rajnikant? 100 people will say that, yes, we know Rajnikant and Pawan Kalyan. And just now go and ask who knows Professor M.S. Swaminathan, who is the father of the Green Revolution of India. And only 10 people who are of intellectual window will know it. Because the reason being, an artist will have that luxury of making an emotional footprint on the country. So, and India is more fans and followers than leaders and serious thinkers and original thinkers. So, I know that you are a scientist, I know that you are good in science and everything, and you have great mentors and great team who can bring a revolutionary advancement in the healthcare. But ensure that you apply the art of war. You design this thing according to the Indian geopolitical domain so that you come up with right people who will ensure that they will take it forward. Because, like they say, India has more fans and followers. So, and I'm sure the man whom he is producing and making the film with, he is one of the only person in the country who has the biggest amount of followers and biggest amount of fans. I have shared you the video, and who you congratulated him in his winning stride. Yes. And his collaboration with the Prime Minister of India.
Yes.
And sir, one more thing I wanted to add. Professor Dato Shri is the senator of BWA Germany, wherein he is the ambassador for the foreign trade of healthcare for Malaysia, Indonesia, and China. So
for German with the 3 countries.
For the German.
I'm the senator.
Yeah. So he is instrumental and influential enough to bring any state-of-the-art technology or the foreign trade to India. That is exactly what I conveyed to the Prime Minister of India and to Shailesh Hiranandani ji and to you also. So, having said that, any questions?
Okay, just a quick one. Since I'm a foreign trade ambassador for Germany, appointed by the German side authorities for China, Indonesia, and Malaysia, I will add one more country here, India. Okay, it is important.
Thank you, sir.
Now, we all know India is the biggest drug manufacturer.
Right.
All the generic drugs come from India because of the low cost. So we will do the same. As an owner of manufacturing plant biopharmaceutical in Germany for the 4 decades, the cost of drugs is getting more and more expensive. Electricity, because of the war, has went up 5 times. And you know the labor cost. Most of the time it's because of the labor cost. It's not just because of the research cost. After the research is production. So the only way to bring this down would be put it down to India. And for that, we will bring the best technology in Europe, including in Germany and Switzerland, right into India, start the production, cut down all the costs, and on the other way, export it out of India. Export out India to the world.
Yep.
Why must you produce everything in Europe when the cost is so expensive? The cheapest labor in India, in Germany, is 7,500 euro. It's crazy. So we want to bring the best in technology down here. We want to bring the best education down here. We want to change the mindset of the physician here too. We can't just treat for money. We must treat with compassion and empathy. And this is something we have to do when you have success in something you do for the patient. This is something money will never buy. In terms of the children, lesser children of a Greater God Foundation, this is non-profitable. We must do this without any profit at all. We must do it for the children because they are the future of the country. Okay, next. What about cutting the cost of the government here? Health cost is the biggest cost in the world for most of the authorities of the world. So if you can cut down the cost of the dialysis, cut down the cost of cardio patients, cut down the cost of diabetic patients, we can do this easily. But this needs the politicians, the smart politicians and the ruling leaders to do this for us. Otherwise, it's impossible to do it.
Dato, one small correction here.
Yes.
So these people are not politicians. While I'm saying that, what I actually meant is Mr. Clark says, a politician thinks about the next election while a leader thinks of the next generation.
Yes.
And so do you say about, sir, you being the ardent...
We need you great leaders to convince the politician, you know?
He means the second politician, not the
Yes.
other politicians.
Yeah. You are the advisors to the politicians, you know. Okay, we'll do our best here. Anything to say from your side? Okay.
Dr. Mike, actually, I'd like to answer your this thing. In 1999, we started a company in India. At that time, there was no internet. We used to have a net station, and I used to start employing 650 people used to work for me in India, in my village. And they're working on the platform which is in Ireland, and working for apps for Motorola and US. This I'm talking about 21 years back, 22 years back, 24 years back, 24 years, 23 years back. So at that time, we don't have a net station here. Even then, we could reach 650 people employed in one location in a village, and one net station is exclusively kept for us. And we used to develop the software application for Motorola sitting in a village in Visakhapatnam, in my town, in my village. So these things can be done because whatever you think, it can be delivered. It not only cutting down the cost need not cut the salaries or anything. Cutting down the cost is one is location. Second one is all the CSRs and all those things are there to support. As I told you in my earlier version, the research should be funded by the government or by the kings, by the rulers. But that's not being funded. If that is funded, your expenses will be very low. You need not spend so much of money. Whatever you spend money, it's all main cost is the R&D. And that should be borne by the governments. And unfortunately, governments are going for popularity and going for the schemes and freebies and all. They're not investing money in the real research. So we would like to bring that change. We would like to bring the change. We would like to bring people to think about the future and next generation. And I would like to request you to visit a place, if possible, whenever your time permits, a library called C.P. Brown Library in Kadapa, in a district in Rayalaseema, about 500 kilometers or 400 kilometers from here. And wherein there is Talapatra Granthas, all the ancient literature is kept there. And one of the leaf they took out, Ayush, and made a beautiful medication now. And there are the people who can interpret those things into the reality. Now the whole world has become global village. Now we are not going to fight anymore, no more Germany, this, that, and all. We are all together to do something for the mankind. And I think you should visit that place and take the science from there and make some sense for the society.
Yes,
Thank
we
you.
will. We will.
So, Dr. Shri, before we go and address the press conference, I would like to take this opportunity to... yeah, they are saying the sound is not coming here. So, these are the CSR activities we are doing for the Indian Army, athletes, and the children with special needs. So, when it comes to the Indian athletes, we have been approached by a lot of sports companies wherein they requested, sir, for a sportsman to get treated before the success is even promised. The rehabilitation and that therapy itself costs so much that by the time they get recover, their careers are gone. So if you as a company can address these sportsmen who are going to add value to the Indian athletes or on a global platform, it would be great. And then I requested my mentor if he can do something about it.
Obviously, we can do that. Increase their stamina. To have a good stamina, you need the heart, you need the adrenals, and you need the lungs.
Right.
We can do that easily. And post their popular days in the later part. Most of the sportsmen suffer with injury.
Right.
Over the rest of their life. So this is time where we also have to give them the quality life.
And we're also addressing the Indian Army who are veterans who are old enough and suffering from any other. So these are some of the CSR activities we are doing. Let's go closer for the photograph.
Okay.
In the background, yeah. This is okay?
Okay.
Is that all right? Yeah.
So, if you're done, we can go and address the press.
Okay. So we're going over.
Yeah, Dr.
Okay.
application. మాత్రమే ఈ ట్రీట్మెంట్ అవైలబుల్ బికాస్ ఆఫ్ ద కాస్ట్ ఆఫ్ ప్రొడక్షన్ ఏంటి ఏదైనా సరే. బట్ లాస్ట్ టైం నేను హిరానందాని గారు మన అడ్మినిస్ట్రేటివ్ హెడ్స్ ప్రైమ్ మినిస్టర్ ఆఫీస్ పిఎం గారితో మాట్లాడినప్పుడు ఆయన చెప్పిన కండిషన్ ఒకటే, సార్ మీరు ఇది ఓన్లీ రిచ్ పీపుల్కి మాత్రమే ఉంటుంది అంటే దేర్ వీ హ్యావ్ ఎ ప్రాబ్లమ్, బట్ గ్రాస్ రూట్లో ఉన్న కామన్ మ్యాన్కి వరకు తీసుకురావాలి అయితే దెన్ మనం మాట్లాడుకుందాం అన్నప్పుడు మేము ఒకటే ప్రపోజ్ చేసాం, సార్ మీకు అంత కాస్ట్ ఆఫ్ ప్రొడక్షన్ ఎందుకు జరుగుతుంది అంటే బికాజ్ ఇట్ ఈస్ స్టేషన్ ఇన్ జర్మనీ. అదే ఆ మ్యానుఫ్యాక్చరింగ్ కంపెనీ ఇండియాకి తీసుకొస్తే దెన్ ఒక నార్మల్ పర్సన్కి కూడా మేము ఈ థెరపీ ఆర్ ట్రీట్మెంట్ ఇవ్వగలుగుతాం అన్నప్పుడు దెన్ వీ సెట్ లెట్స్ డూ ఇట్. అండ్ వాళ్ళు మాకు గ్రీన్ సిగ్నల్ ఇచ్చిన తర్వాత what we first did was we created an application called the Loop, where Indian scientists and doctors and global scientists and doctors can work as a common platform by exchanging the problem statements. And number two, thanks to my mentor, ఇప్పటి వరకు ఇంటర్నేషనల్ అసోసియేషన్ ఆఫ్ సెల్ థెరపీలో అండ్ ఇంటర్నేషనల్ అసోసియేషన్ ఆఫ్ స్టెమ్ సెల్ థెరపీలో ఇప్పటి వరకు ఇండియన్ చాప్టర్ అనేది లేదు. Now my mentor has said that Indian chapter could open cheddam, wherein మన doctors and scientists will work with the global team from Japan, Switzerland, Europe and America, and that way మనం ఇంకా ఎఫిషియెంట్గా ఇండియన్ పాపులేషన్కి అడ్రస్ చేయొచ్చు అని. అండ్ on top of it, we have a special concern for children, which is why we are launching an organization called the Lesser Child of the Greater God. March చెప్తున్నప్పుడు we are talking about children who has autism, cerebral palsy, Down syndrome, ఎవరైతే ignored class of children ఉన్నారో వాళ్ళకి ఏమీ చేయలేమని, we can help them right now. ఈ ప్రాసెస్ ఈ ఇనిషియేటివ్ భాగంగా we are also opening an IT platform where our parents అందరూ రిజిస్టర్ చేసుకుంటే we will have an access to the technology. And third importantly, as a CSR, corporate social responsibility towards the country, my chairman has ensured that there is a specific quota for Indian athletes and Indian special children. Athletes enduku ante we had got proposals saying that sir oka sportsman success ayyak double vastayi gaani success ayya process lo evaru pattichukoru sir, వాళ్ళ రీహాబిలిటేషన్ ట్రీట్మెంట్ ఎఫర్ట్ చేసే పార్టీకి వాళ్ళకి కెరియర్స్ అయిపోతాయి. సో లెట్ us if you can do something about that అన్నప్పుడు అడిగినప్పుడు చైర్మన్ గారిని he said that we will do it as మన కెపాసిటీలో ఉన్నంత వరకు we will address them free of cost అనేది ఒక థాట్. And veterans Indian Army. So this event is to create a connections and networks towards the Indian doctors and scientists and launch the application, launch the Indian chapter of the International Association of Cell Therapy and launch the Lesser Child of the Greater God. ఇది ఇవాళ జరిగిన event యొక్క motives. So I would rather now request in this course we encountered with Janasena Party President and the General Secretary, Mr. Pavan Kalyan Garu as well as Mr. Bolsetti Satyanarayana Garu, sharing our conversation what we had with the Hiranandani ji had with the Prime Minister's office, and if they can create a conducive environment in Andhra Pradesh to set up this manufacturing plant. Annappudu they also promised us that Andhra Pradesh has a very long coastal belt where we can ensure that we can create a conducive environment for all of you. Anedi that is what they promised. Now I'm thankful to all the dignitaries who joined us today, Sunita ji and A.M. Ratnam Garu, Bolsetti Satyanarayana Garu, to ensure that this technology will have a voice in creating an impact and changing the health landscape of the country. And మనం ఇది కనుక తీసుకురావడంలో సక్సెస్ అయితే ఇప్పుడున్న డిసీజ్ ఇండెక్స్లో సగం బయటకు వెళ్తాయి, కొత్తవి రావచ్చు. దానికి మళ్ళీ మాలాంటి శాస్త్రవేత్తలు డాక్టర్స్ ప్రయత్నిస్తారు, బట్ ఉన్నవైతే బయటకు వెళ్తాయి. సో ఐ వుడ్ after having said this motives, I would rather ask my fellow my chairman as well as Bolsetti Satyanarayana Garu and the rest of the dignitaries to talk.
కొంచెం జరపండి సార్ మైక్.
మీడియా మిత్రులందరికీ నమస్కారం అండి. ఈరోజు డాక్టర్ అల్లం రవితేజ్ తాలూకా ఇన్విటేషన్ మీద ఇక్కడికి రావడం జరిగింది. ప్రొఫెసర్ డాక్టర్ శ్రీ మైక్ చాన్ యాక్చువల్లీ ఒక ఇంటర్నేషనల్ రీసెర్చర్, వరల్డ్ రెనౌండ్ సైంటిస్ట్ స్టెమ్ సెల్ థెరపీ, దాని తాలూకా బయో జనరేషన్ అని చెప్పేసి బయో జనరేషన్ ట్రీట్మెంట్ అనేది ఒక ఆధునిక శాస్త్రం వచ్చింది. ఆధునిక శాస్త్ర పరిజ్ఞానాన్ని మన దేశానికి తీసుకురావడానికి కృషి చేస్తున్న అల్లం రవితేజ్ గారికి, మిగతా వాళ్ళందరికీ కూడా డాక్టర్ ఆల్గా, డాక్టర్ దిమిత్రి అండ్ డాక్టర్ సైమన్ అందరికీ కూడా మన దేశం తరఫున వాళ్ళందరికీ వెల్కమ్ చెప్తున్నాను. అంటే ఇప్పుడేమంటే మన పురాతన శాస్త్రాలు ఉన్నాయండి, మన పురాతన వేదాలు ఉన్నాయి. వేదాల్లో కూడా బాగా ఏకంగా ఒక తలకు పోతే ఇంకొక తల తీసుకొచ్చి పెట్టినది కూడా ఉంది. స్టెమ్ సెల్ థెరపీ కూడా ఒక అంగం పోతే ఆ అంగాన్ని మళ్ళీ పునఃసృష్టించవచ్చు. అంటే ఆఖరికి హార్ట్, ఇప్పుడు ప్రస్తుతానికి ఎక్కువగా వస్తున్న లివర్ డిసీజ్ కూడా ఆర్టిఫిషియల్ లివర్ తయారు చేసి ఏకంగా మనిషికి ఏర్పాటు చేస్తున్న రోజుల్లో అటువంటి శాస్త్ర విజ్ఞానాన్ని మన పురాతన శాస్త్రానికి సంబంధించి, ఎందుకంటే మన వేదాలు చాలా విషయాలు చెప్తున్నాయి, వాటిని కలిపి చూడాలని కూడా నేను వాళ్ళకి విజ్ఞప్తి చేయడం జరిగింది. వాళ్ళు కూడా చాలా దాని గురించి మంచిగా చెప్పడం జరిగింది. అయితే ఇది చాలా స్వాగతించదగ్గ పరిణామం అండి. ఎందుకంటే మన ఇండియన్ ఆర్మీకి సంబంధించిన అంటే వికలాలైపోయిన వాళ్ళకి కానీ, అలాగే క్రీడాకారులకు కానీ, అలాగే పుట్టుకతోటే దివ్యాంగులుగా పుట్టిన వాళ్ళకి కానీ, వీళ్ళందరికీ కూడా ఉచితంగా వైద్యాన్ని అందించడానికి ముందుకు వచ్చిన సంస్థకు ముందు నేను మన దేశం తరఫున కృతజ్ఞత తెలుపుతున్నాను. అలాగే వాళ్ళ ప్రొడక్షన్ కాస్ట్ తగ్గించుకోవడానికి మన దేశానికి వస్తానంటే, నేను ఆంధ్రప్రదేశ్కి చెందిన వాడిగా మీరు ఆంధ్రాకి రండి, తప్పనిసరిగా మీకు కావాల్సిన సదుపాయాలన్నీ కూడా కుదురుస్తామని చెప్పడం జరిగింది. అలాగే ముఖ్యంగా జనసేన పార్టీది ఏంటంటే ఒక పర్యావరణాన్ని పరిరక్షించే అభివృద్ధి చేస్తాను. ఈ చాలా వరకు వచ్చిన డిజార్డర్స్ అన్నీ కూడా పర్యావరణం సరిగా లేకపోవడం వల్ల కూడా వస్తున్నాయి. కాబట్టి ఆ పర్యావరణాన్ని పరిరక్షించే అభివృద్ధి చేస్తాను. అలాగే మన సంస్కృతుల్ని, సాంప్రదాయాల్ని కాపాడుకుంటూ ముందుకెళ్లాలంటే మన పురాతన శాస్త్రాలని కూడా తీసుకుని వెలికి తీసి చేయాలని, అలాగే వీళ్ళందరినీ కూడా కడపలో ఉన్న సిపి బ్రౌన్ లైబ్రరీని ఒకసారి సందర్శించి, ఎందుకంటే మనం దేశ ప్రధాని గారు ఆయుష్కి అక్కడ తాళపత్ర గ్రంథం నుంచి ఒక పత్రం తీసుకొని మంచి ఆయుష్లో మంచి మందు కనిపెట్టారు ఇప్పుడు. అలాగే అటువంటివన్నీ కూడా మన తాలూకా ఏన్షియంట్ నాలెడ్జ్ని, మన పురాతన శాస్త్రాన్ని, మన పురాతన అంటే విజ్ఞానాన్ని ఆధునిక విజ్ఞానంతో మిళితం చేసి ముందుకు వెళ్తే ప్రపంచానికి మంచి రిజల్ట్స్ వస్తాయనే ఉద్దేశంతో నేను తప్పకుండా వీళ్ళకి ఏ రకమైన సదుపాయాలు కావాలన్నా ఆంధ్రప్రదేశ్లో అన్నిటికీ ముందుకు చేస్తామని చెప్పేసి చెప్పడం జరిగింది. అలాగే ఇటువంటి మంచి కార్యక్రమాన్ని ఇక్కడ తీసుకొచ్చినందుకు వీళ్ళందరినీ అభినందిస్తూ, అట్ ద సేమ్ టైం మనకి ఏమైనా దీంట్లో ఇబ్బందులు రాకుండా ఉండేటట్టుగా, ఇదివరకు ఏంటంటే రీసెర్చ్ అనేటప్పుడు అంటే మనకు వేల సంవత్సరాల క్రితం చూస్తే ప్రభుత్వాలు రాజులు చేసేవాళ్ళు, రాజుల తర్వాత ప్రభుత్వాలు డబ్బు ఇచ్చేవారు రీసెర్చ్కి. ఇప్పుడు రీసెర్చ్ అనేది పక్కన పడేసి మనంతా కూడా ఉచితాల మీద వెళ్ళిపోతాం. ఉచితాల మీద కాకుండా మనం కొద్దిగా రీసెర్చ్ మీద డబ్బు పెడితే ఆ రీసెర్చ్ వల్ల చాలా వరకు మన బాధలు తగ్గుతాయి, భవిష్యత్తు బాగుంటుందనే ఉద్దేశంతో వీళ్ళందరితో కలిసి ముందు డిస్కస్ చేయడం ప్రారంభించాం. తప్పనిసరిగా ఇది ఒక మంచి పరిణామం. ఎందుకంటే దేశ ప్రధాని దగ్గర నుంచి ఒక రాష్ట్ర ముఖ్యమంత్రి వరకు అందరం కలిసి ఒక కొత్త మెడికేషన్ని మనం స్వాగతిస్తున్నాం, కొత్త రకమైన మెడికల్ టెక్నాలజీని మనం స్వాగతిస్తున్నాం. అందరికీ కూడా మీడియా అందరి మిత్రులందరికీ కూడా ధన్యవాదాలు.
Well, ladies and gentlemen, first of all, on behalf of our entire group, European Wellness Biomedical Global Group, I'd like to express gratitude to the invited party and our Bharat, our Indian chapter. And I'd like to thank the organizers as well as everyone who came today, yesterday, and today to listen to our lectures and share our vision, share our philosophy. I personally am a great admirer of Indian culture and Indian history. It happened that I have quite tight connections with India because around 20 years ago I was lecturing to a lot of Indian students, same as my colleague, Professor Olha. I believe that she will lecture more because I left my country a long time ago to relocate to Asia, and I was living and working in Malaysia for 15 years, and that's where I met Professor Mike Chan, and about a decade ago I joined his group, and it's a great privilege for me, and we have joined forces together in a fight, and I believe it's a noble fight, a fight against aging and a fight against disease. Because you're all witnessing that the quality of life and the standards of living all over the world are getting better. It's increasing, it's improving. We are fighting poverty, and we are extending the lifespan of people. As a result of that, we have a huge percentage of aging population. Very soon, we're going to have around 20-25% of people who are older than 60-65 years old. With that longevity unfortunately, comes a very long list of chronic degenerative diseases of aging. And those diseases become number 1, number 2, and number 3 factors and cause of death. That is not great. Apart from that, there's a huge amount of budget in every country, and these are money that are earned by taxpayers and contributed to the government, and that money is spent on the healthcare to fight those chronic diseases of aging. We can see that even though conventional medicine is improving tremendously, it's progressing, it's advancing, but still such diseases as diabetes, stroke, Alzheimer's, dementia, they are on the rise all over the world. And in the same time, the developmental disorders of the child, the early childhood disorders such as autism spectrum disorders, they are increasing year after year, decade after decade. And all of that brings us to the search of new solutions to that. And the solutions are understanding of how we age, what are the mechanisms of aging. That is done by scientists in a lab. And further implementation of the therapeutic treatment modalities into real life, into the clinical setting. That is done by practicing physicians. So that's how scientists and practicing physicians meet together, join our forces in the European Wellness Biomedical Global Group. And this company, this group of companies, exists for more than 4 decades. We have been in all continents except one. We haven't been to Antarctica yet, right? Yes. Otherwise, we have been to Northern America, Southern America, Europe, where it all started, Africa, Asia, of course, where is the main hub. And I feel that Indian subcontinent was somewhat neglected, and I'm very happy that finally we're here. I have to tell you that this past 2 days we had a fantastic, tremendous response here. We have met great scientists, we have met leaders of the society, leaders of the community, politicians, key opinion leaders, people from the movie industry. I know that in India it plays a huge role in the social life. And also we've met doctors who, some of them we know from the past conferences that they went overseas to attend our conferences in other countries, and they came, they found out that we were coming to India these 2 days, and they came, visited, and listened to our lectures, and hopefully that they will join our forces and be fighting soldiers of the Indian Army against aging and disease in India. So we are involved in research and clinical application of cell therapy, stem cells, immunotherapy. We address all ages, all genders, all sexes, and all different conditions. As long as it is a disorder that can be reversed with biological regenerative medicine, we are trying to find effective solutions for that. We are very delighted that we have support and understanding such wonderful people from different industries and different aspects of life. Once again, thank you all very much, and we are looking forward for really fruitful collaboration with our Indian counterparts. And let's bring quality years, not just extend life, but let's extend the quality lives to the society, to the people, million people of India. Thank you very much.
Okay. Now, it's a wonderful experience for me. Being 4 over decades in this field of bioregenerative medicine, started everything in the 80s with the Swiss and the Germans and with the Soviets. It is high time we have to bring this all to India because production in Europe is getting so expensive that we must cut down the cost, bring the best technology, have the production in India here, and export it out of the world. But at the same time, we must save all the children of India. This is a country with the most populous people around, the most amount of people, the most amount of doctors, the most amount of patients. And it's high time for us that we must provide education to the physician, educations to the public to understand more about their own health. Because I always say the public themselves, the non-doctors themselves, the patient themselves should be their own doctors to a certain extent. Because all the doctors in the world will never have all the time for the patient. So it's high time education is important to understand about their own health. And health cost is getting so expensive these days. And it's costing a big toll for all the governments of the world. So if we can cut down on dialysis, we can cut down on medication or diabetic drugs, we can cut down on Parkinson or Alzheimer, all kinds of diseases, that would bring down the cost and lower down the toll on the government. And this saving in cost can be spent more into education and research further. And that should be the way instead of spending all the money on the drug side. So it's high time that we have to do this, bring the technology down, bring the best of what you have in Europe, be it in Switzerland or Germany or all parts of the world, and bring the best information, bring the best education with scientists and clinicians or doctors or physicians from all over the world right into India. And with the look, we are going to combine everyone together. So everyone is accessible to some of the top universities of the world, some of the top scientists from them, and everywhere. This is the right way to move, to cut down the cost and spend the extra saving into development of the country. We are spending so much money for the economy of the country, every one of us, every country, every government of the world. So it's high time that make India already the generic drugs of the world, the producer, to another level. And since the government of India, together with the Prime Minister of India, has been molding the situation of cancer therapy with CAR T cells, that means immunology is very important. And being us as one of the world, in fact, we are the world's largest manufacturers of immuno drugs, raw materials. We call it active pharmaceutical ingredients of the thymus gland, which is the immuno drug with thousands of applications on super boosting your immune system. Your immune system starts to go down after 60 because the thymus gland more bigger than your heart, which is producing the T cells or the immune cells, is totally gone after 60. So because of that, you must complement with the immunodrugs. During the COVID, the Chinese government was saying very well that they did it successfully, treating COVID patients with TCM, traditional Chinese medicine. But they also do it together in supplementation and complementation with thymus therapy, but they were doing it with synthetic thymus. And here we are the world's largest manufacturer in Germany, and the only one approved by the European Pharmacopoeia for these drugs, for these raw materials. It's high time to bring them down to India because the labor cost in India will be the cheapest of the world. So why don't we produce this instead of producing in advanced country where the cost is all in the labor cost? So this is what we want to do here. And again, education is a must for all the doctors of the world. We will provide the best education, and we have to work hand in hand. So in other words, India will benefit in terms of biotechnology. Indians will benefit in terms of education. India will benefit in terms of saving in costs. And India will have an extra income by exporting the drugs out of India. And what about the rich in India? They have been going out of the world for their cancer therapies or all kinds of therapy. why don't we make India the immuno center of the world, the immunology center of the world, and we can do that in line with your Prime Minister wishes to make India to treat cancer patients, because cancer is one of the most expensive drugs for all the patients. Okay, and 1 out of 4 or 5 of us after 60 could be a patient for cancer, a potential patient of cancer, and this cause is killing. So it's high time to do this, set this as a center of excellence for education, for the academy, center of excellence for the non-physician to learn more about their health, work hand in hand with the government of the world, the health authority, to provide education. Example, today we have Liver Day, then we talk about liver to all the non-public health to take care. Diabetes Day, we talk about diabetes. So that is the way to do it, and we are blessed to have producers here or people in the movie industry to disperse the news to the rest of the world in India. And it's not only in India, because there are also India all over the world. So it is important to do this, and it is with a good conscience we want to bring the best here. In terms of treating the children, our dream will be to treat them without making a single cent from all these poor children. We shouldn't be making money from poor children. They are called special needs children. That means they are handicapped in a way. So let's do it with the heart, and all the physicians must treat with a good heart. Thank you so much.
అందరికీ నమస్కారం. మన దేశంలో ప్రతి ఒక్కరికి షుగర్, కిడ్నీ డిసీజ్ ప్రతి ఒక్కరిలో ఉన్నాయి. చాలా చాలా చనిపోవడం కూడా జరుగుతుంది. గ్రేట్ సైంటిస్ట్ అయ్యారు. నేను విన్నాను, చిల్డ్రన్కి హ్యాండిక్యాప్డ్గా ఉంది, దానివల్ల మెడిసిన్ తయారు చేశారు. సెల్ థెరపీ వల్ల పాడైపోయిన కిడ్నీ మళ్ళీ రీజనరేట్ చేయడం, ఈవెన్ కిడ్నీ కూడా క్రియేట్ చేయడం. అలాంటి టెక్నాలజీ చాలా ఎక్స్పెన్సివ్. ఇండియాకి వస్తే లేబర్ కాస్ట్ తక్కువ అవుతుంది, పాపులేషన్ ఎక్కువ ఉంది కాబట్టి ఇండియాకి ఎకానమీ పెరుగుతుంది. మన ఇక్కడి నుంచి డ్రగ్స్ విదేశాలకు వెళ్తే తర్వాత మనకి ఎంప్లాయ్మెంట్ దొరుకుతుంది. అదే ఎస్పెషల్లీ ఆంధ్రాకి వస్తే ఇంకా మన అందరం చాలా హ్యాపీ ఫీల్ అవుతాం. సో వెల్కమ్ టు ఆల్ ద సైంటిస్ట్ టు కమ్ టు ఆంధ్ర. సో గ్రేట్ థింగ్. అందరూ
This will be our home too.
విద్య, వైద్యం ప్రతి ఒక్కరికి ముఖ్యం. సో చాలామంది చాలా పెద్ద పెద్ద కాస్ట్లీ డిసీజ్ వచ్చి క్యూర్ చేయలేక చాలామంది చనిపోతున్నారు. ఎప్పుడైతే షుగర్ వచ్చేలో ఖచ్చితంగా కొంతకాలంలో కిడ్నీలు పాడవుతున్నాం, చాలామంది చూస్తున్నాం. సెల్ థెరపీతో కిడ్నీ రీజనరేట్ చేస్తానికి చాలా ఆశ్చర్యం ఉంది. ఈవెన్ రీక్రియేట్ కూడా చేయగలని చెప్తున్నారు. సో అటువంటి టెక్నాలజీ గ్రేట్ సైంటిస్ట్, దే ఆర్ నాట్ సైంటిస్టులు వచ్చి ఇక్కడ చేసి ఇండియా ద్వారా విదేశాలకు మెడిసిన్స్ వెళ్తే మనకి బిజినెస్గా హెల్ప్ అవుతుంది, ఎంప్లాయ్మెంట్ దొరుకుతుంది. చాలామందికి మామూలు ప్రజలకు కూడా మెడిసిన్స్ అందుబాటులో ఉంటాయి కాబట్టి ఖచ్చితంగా ఇండియాకి
Thank you. Thank you. Okay. Thank you so much for all of you. Okay. Thank you. Thank you.
టైరో భయ్, టైరో కూర్చో నాదంలో నువ్వే ఉన్నావు నజ్జికాయ బాయ్ రికార్డ్ नहीं है भाई ना लाइव है कहीं को गुस्सा కెమెరా ఆడనట్టు వెనక చూసాను ఇవ్వడు ఇస్తే నాకు ఓకే రాకూడదు కెమెరా వచ్చేసాను కూడా
For the world, from India, with a good heart, let's enrich life and give life.
राकाई को पूछते रहे भाई ना लाइव ना कई को रे भाई रा पूछते
Thank you everyone.
ఏమన్నా చప్పకన అడ్డు వచ్చాడు వచ్చేవాడు సీరియస్
बच्चा ये बच्चा नहीं
बेटा कैमरा लेके वीडियो ले रहा था तो चिक चिक करा तो मैं उससे बात करा सुने तुम आके मेरे को सूरत देख रहे सूरत देखे तो रिश्ता तो भी लगाओ बहन तो भी देख के शादी तो भी करो बहन जी
time.